I'm going to ask it again, and then I'm going to thank you for your time, thank Mr. Chair for the leeway. But I've asked this question before, and I don't know if that question is for yourself or for Mr. Laird. But it's very important for me to understand exactly what the Office of the Tax Collector in particular, and of course the Office of the Lieutenant Governor overall, is really doing to ensure that we are able to ramp up our collections, particularly in the current year. Meaning, we just have to figure out what that plan is to stop the deltas, to stop the bleeding. So what is that plan to really get us to a place where we are able to come before the legislature and say, what are the KPIs we're looking at to say, we are moving to get to 80% to 90%. What's that plan in the year that's in front of us?
Okay,
Thank you, Mr. Chair, for the time. I'll listen on your time.
The tax collector would be in a better position because he has various plans to get us there.
Mr. Laird?
Thank you, Senator. Brent Laird, I'm tax collector. We are having a multi-pronged approach towards collecting the delinquencies. And so one of the key things that the Chief of Staff mentioned is going to happen in the next couple of weeks is going to be that delinquency publication. And oftentimes, historically, we've shown that once people see and understand that their names are published in the papers and that we're about to take the next moves, that generates persons to come in and pay on their delinquencies, whether by payment plan or by applying payments directly to the delinquent year.
Could Mr. Laird, in reference to not even going back with outstanding property tax owed, what is the plan as to how you're going to collect the $70 million that is owed this fiscal year?
Okay, Senator, let me just make it clear, if you would allow me, sir.
Sure.
The $70 million is what we would, if you just put all the taxes out there, no credits and no other things, exactly. That's what we'll collect. But because of the credits add up to around $20 million, that brings it down.
That wasn't a question. The question was the 86,000 bills that are sent out. What does that total? And that is with the homestead and with veterans and everything. What does that 86,000 bills, what is the projected total if you collect those 86,000 parcel bills that were sent out?
Total of that would be around about $55 million.
Then, no, because the 53 million, Mr. Laird, how much of that projection includes past due amounts from previous year?
For the 53 million, Senator, 20 million represents delinquencies and 33 million represents current year taxes.
Okay. So you're saying that the 86, and this is a cumulative amount that you guys have run, the 86,000 bills represent some 50-something million dollars due every year. After all exemption, it comes down to 50-something million dollars.
Yes, sir.
And we're collecting about 30 million of that.
Yes, sir.
So we're collecting, what, like 60%?
Yes, sir.
So the question is, how do you collect that additional 40% for the present fiscal year? How is it moving? Suppose 60 was the average every fiscal year that we collected. How do we move from 60 to 65 or 70 the next fiscal year and then still be going after the back taxes?
Senator.
Well, thank you, Senator. In the first year of bills, once bills are run, we typically have, I would say, about more than 50% collected within that first year. The majority of that is collected in the months between June and September.
Right, that's why I said about 60%. But I think what I was looking to hear, let me just put it on there. There's a tremendous issue in reference to probate. Properties that exist among multiple family members and nobody paying the property tax. So the property have just sat there for a number of years and no one is paying the property tax. And that particular, I'll use the word delta that the last senator used, exists every single year. So what is the plan as to how we're going to be able to deal with all of these literally abandoned properties or properties that are in probate? Nobody is actually taking responsibility. What is the plan that we're going to be able to, the outstanding taxes on those properties or get those properties back into circulation? I mean, nobody wants to hear about actions, but you can't have a property that's within a family and there's 15 years of outstanding property taxes and it's just allowed to remain that way. And I think that is why we see so many abandoned homes on St. Croix, St. Thomas, I know St. Croix, St. Thomas for sure, that just exist and which can add to the,
Let me start by saying, Senator, the amnesties they bring in.
Yeah, but this isn't amnesty. This is 10 families own it, everybody arguing who is going to be the owner, nobody paying the taxes.
Well, when we move forward with, and we've started to move forward, especially with the older properties, with the notices, that is a process set by statute where we're going to get to the auctions. Okay. And like you stated earlier, Senator, the auction process, it is actually the auction process or the process leading up to auctions that really bring in a lot of the monies, the delinquent monies, as soon as people realize that their properties are going to be sold. I think, for instance, in 2017, we started out with a large number. Attorney McLean could give maybe more of an exact number of properties that were to be sold in the auction process. And by the time we got to the end of that, people had already run in and either paid or entered into payment plans to pay. And there were only none, I believe, on St. Thomas. There were a couple, maybe 2 or 3 on the island of St. Croix. So the whole process leading up to the auctions brings in a lot of the monies. And that's what we're moving forward with.
Thank you. Point of inquiry, Senator, who was it? Senator Francis Heliger.
Good afternoon. When I asked the question earlier in regards to the percentage as it relates to probate versus the collections, because that's important to me, because we know there's a large issue at times dealing with the judicial system. Not every aspect of property taxes has to do with family members not wanting to pay. Some of it is because some of these things are stuck in our judicial system for years. Are those property going to be susceptible to potentially going through the auction process as well?
Okay, Attorney McLean, I'm going to let you speak to that, please, as regards to the process.
Yes, ma'am. No. When properties are in probate, just for the record, we like properties that are in probate, because probate, you go to the court and the court gives an order of administration to a person or an institution. But there is a person who is responsible for this property that is now part of the estate of the decedent. So we like having a name, because then we know who to send the bill to. We know who to contact if something goes awry. So we like probate. Secondly, with respect to probate, we do not sell those properties. Because normally it's a little, you need permission from the court. It's just different. It's a court order proceeding. So we're not going to sell it. It's just a little more challenging. But we do have someone who is responsible for the taxes. I don't know if that helps to clarify things a little.
Thank you for your response.
Senator Joseph, point of inquiry.
Mr. Chairman, and I want to go to page 44. These are your performance indicators. Specifically, I'm looking at your key performance indicator for the collection of property tax. You have a target of 100%, but as of That's your target as of June 30th, 2021. You have only been a little over a quarter of that. 27%. You're meeting your target. Again, it goes back to the question relative to how, I know you have a new system with the tax collection, but how is this system going to make us be able to collect tax more efficiently and quickly? That's my concern. I want to also just commend because 20, if you're in a grading system and you're a teacher, that's a flat out F. You're not even meeting your own indicator that you set as a target. You have the corporations and trademark, they're almost there to meeting their targets with their key performance indicators.
Senator, let him answer the first one first, because you hit with the property, the performance.
Yes.
So if you can answer that, because it's there, so let him answer the question. In reference to the property, Mr. Leda, the key performance indicators and the target that you have.
Yes, thank you, Senator. Brent Laird, I'm tax collector. So the key performance indicators are indicative of our goals. And so we have cycles within the revenue collection for property taxes. And right now we are in a cycle coming towards the end of the fiscal year, which is a high point. This is where people oftentimes come and pay before the new bill becomes delinquent. And
okay, let me just be specific. Your key performance to increase the year-over-year delinquency tax collection by 5% annually. You're saying that you believe you're going to meet that target?
Yes, Senator.
Okay, because of the billing cycle, you're going to meet that target. Okay, to increase the number of installment payments, 1 minute, to increase the number of installment payment agreements issued by 5% annually, your target was 100 and you're at 27. Are you going to meet that target?
We believe we will, Senator.
In the last 3 months, you're going to increase by 75%?
Let's be realistic. No.
This installment payment.
Persons coming in and applying for installment payment agreements have really come in within the past month. As I said, because it's cyclical, once the bills become due, and more so, also buttressed by when we do the delinquency publication, that's what drives people in to do the installment payment agreements. And so, yes, Senator, we do believe that as people realize that this is a way to stay off of the auction list,
so
that we will hit those
for those outstanding property tax bills, we're sending out letters to them and asking them to come in and go into an installment plan. We're sending out some type of written correspondence and telling them that they can come in and set up an installment plan?
Yes, Senator. The first notification is on the subsequent bills.
No. I'm not talking about the subsequent bill. I'm talking about documentation that is going to a landowner. Please be aware that you owe property taxes from 2004 to 2012 in the amount of blah, blah. You are allowed to come into the office and set up an installment plan. Are we writing specific correspondence to them?
Yes, Senator. We have a process of notification for all parcel owners once they become delinquent.
That wasn't that wasn't the question, though.
Yes, we are sending notifications to customers that are delinquent, in addition to the subsequent bills, which list the delinquencies.
Point of inquiry, Senator Fred Gregory.
I know that you spoke about sending out information to the public with regards to individuals that are owed property taxes for years. And I am all for that. However, I think when we ask questions, it needs to be answered so we could be clear on what's being answered. The question is, what is the process that you're utilizing to inform property owners who have outstanding property taxes outside of the information that's sent on their annual bill? Is there a process outside of that? That's the question. And what is that process, if there is a process? And if there's no process, please don't take me down the road. Just say ain't got no process.
Senator Claudette Farrington, Mr. Ledham can speak to the process. I recall when he came on board, the plan was, like he said, besides sending out the regular tax bill, we had a plan in place.
Is it being done?
What I'm saying is we had a plan in place to push out delinquency notices, send out cyclical, you send out a first notice, you send out a second, you send out a third over a period of time. I recall that.
I mean, Claudette, you're my friend. You're my friend.
I recall that.
I mean, Ms. Farrington, I'm sorry.
Yes, okay.
The question is, but it's okay. It's okay that's what you, no, allow me.
Okay, go ahead,
it's my point of inquiry. And I'm every time I ask this question, I ask it from my first term, and I'm asking it again, and I continue to get the runaround, and I'm really getting frustrated. Okay, the plan is fine. The only thing I want to know is it implemented? Yes or no?
Okay, Mr. Ledham can speak to that.
No. Please. Is the plan implemented? Is it a yes or is it a no? And if it's a no, the question is, when will it be implemented? It's as simple. Come on, you can't keep doing this.
Okay, one minute. One minute. We're going to give you 2 minutes to come up with an answer. The committee is in recess for 2 minutes.
Okay, I'm sorry. I'm reaching.
The Committee of Finance is back on the record. Mr. Ladon, have you started the process of sending out first notice, second notice? Oh, Attorney Kavan?
Senator Fred Gregory's question. The short answer, no.
Okay.
We have
Fine.
been operating on a short staff in the office. One employee on the island of St. Thomas. We have, 3 on St. Croix, but 1 on St. Thomas. So there have been challenges, but we are interviewing people. We have interviews scheduled to bring on persons. We have a list compiled to assist with that project, and we want to we want to tell the people of the Virgin Islands that your property will not be taken, cannot be taken through the auction process without us following the statutory requirements
Correct.
of notifying them individually of their delinquent taxes.
How many, coming to you right now, Senator, how many vacancies you have in that office?
Currently, you're saying?
Yes. Projected, I'm seeing you have real property, what is it? REC is what, record officer?
Where are you, Senator?
Real
Page 12 of 16.
The real property tax.
12 of 6.
No, you have 2 real property tax collector
Mm-hmm.
Right.
at entry level pay. That's a unionized position?
Yes, those
Yes.
are unionized positions, Senator.
Okay, and then you have real property, what's the REC? Record? What is it?
That's in recorder.
We have real property record officers that are in record of deeds, as well as the office of the tax assessor.
Okay.
And we have real property tax collectors in the office of the tax collector.
So which of these positions is going to help to expedite sending out the first notice, second notice? The real property tax collector?
Real
Yes.
property tax collector.
Yes, Senator.
And
And we
how
also
many
have
total positions you plan to try to staff up that office with?
could you repeat
How
the
many
question?
additional positions you are trying to hire for the office so that we can have all the processes expedited?
For right now,
Right
Senator
now.
Claudia Farrington, to start, we anticipate having, give me a minute, but we anticipate having the tax collector, a chief enforcement officer, and 3 staff on St. Thomas, for St. Thomas St. John, and on the St. Croix, in the St. Croix district, a chief enforcement and 3. So that would be 6 and 7 to start.
How much do you need?
How much do we need?
And you can answer that after. Tell me how much do you need over the additional monies that I'm projecting you're going to collect more revenue than what we have here in the.
We need all of our monies in general fund and all other local funds. Every cent.
And I'm saying yes.
dime.
I'm saying yes. Yes. Okay. Yes.
I'm serious
Okay,
because.
Wait. Well, hold me.
Okay.
One
All right.
minute.
Okay.
I'm saying that there appears to be some additional funds that will be collected through the financial services. Those monies could be utilized for anything in Office of Lieutenant Governor, correct? The statute doesn't specify that it has to stick to that.
I will have to check that with council, but I don't think
I pull it up.
so. But the point is, when it comes to financial services fund, again, we're working on contract amendments. We're working on.
Yeah, but I'm saying if there's anything extra, we carried over 3 million. We projected we're gonna collect the next 6. If there's any carryover, I mean, eventually you might have to come on the general fund. But if there's any carryover, you have $852,000 you're projecting in personnel and 376 in fringe. I'm just saying, is there a possibility that you could increase the personnel and increase the fringe so we could bring more individuals on? You have it increase.
We could.
The other services and charge by 2 million. We just saying we juggle a bit.
We could.
Okay.
We could take a look at that.
Okay, thank you. So we're on the same page. Finally.
Oh,
A good thing.
We could take a look at that.
If you have a mortgage, your property tax is escrow, correct?
Okay, it comes through then.
Have you guys reconciled the payments on the banks for property tax? They escrow a certain amount every single month. have you been able to reconcile all existing mortgages that have escrow accounts for property tax and those have been paid by the bank on behalf of a property owner? Have those amounts been credited towards a particular property?
Senator, if I can explain the process, what we do, because persons pay out their mortgages during the year, and because persons are added to the list during the year, when we are about to bill, we send the latest list, the prior list, to the banks, asking them to update that list for us so that we'll know who all should be billed through their institution. So they have an opportunity to bring on the additions for which they are collecting monies, including taxes, and then they have the opportunity to also delete persons who previously paid.
Are we up to date with the process? Is the process done timely, that we're up to date with that particular process, that the monies that the banks are paying are credited towards that particular property?
Senator, I would say yes, it happens every single year.
You say yes, okay. Now, I'm still getting a lot of I'm still getting a lot of inquiries into, and this is on the real estate market, that the tax clearance letter is really taking a longer than usual period of time. That before it was a 3 to 4 day window, and now it is weeks. So if we could really look at that, because they're saying that some transactions are falling through because it's taken so long for it to be processed, that we're losing money in that particular market. So just one of the areas that we need to seriously look at and make sure that we're able to improve.
We will.
Okay, Senator Sarah, I've been waiting forever. I'm going to do Senator Francis Heilaga, then I'm going to go to Senator Sarah and then come back. Okay, Senator Francis Heilaga.
I have been sitting here for a very long time listening to the testifiers, and one of the things that have really been a cry in my side has to do with the rules and regulations being followed in regards to before you get to the point of publishing someone's name in the papers. One of the things in regards to those rules, and our law is specific as to what myself and colleagues have been talking about. I know for a fact these notices have not been going out, because even with your own testimony and one of the gentlemen here, you guys were very adamant about sending out your publication with people's lists, but you never reference doing the notices. And that's something you guys have not been doing for a very long time. And the problem with that is, unless somebody sues this government, because you cannot have laws on the books where you circumvent the whole process and jump straight to the part about publication, and then that causes a major issue, because then people could come and sue this government for you guys not following the process. If you did 20,000 of them, you guys are responsible to prove that you sent out 20,000 letters. But this is not happening. And it's a major problem for me as a representative of the people when you were here all giddy about publication in the newspaper, but then you're telling me you never even gone through the process to make sure that these notices were being sent out. And this is not just for this year. This has been for several years, because I personally had to help individuals challenge these situations with the Lieutenant Governor's office. So I'm only asking, last statement, I'm only asking that you guys please follow the procedure, because it's a safe haven for the government, as well as protecting the people of this territory to retain their property if they need to. Thank you.
If I may clarify.
Attorney Caban, I think that we did ask that. You said before you send out any notice to the newspapers, you will make sure that you send out a first and a second notice to follow all of the guidelines to make sure that the protections that exist for people and property will continue.
What I also stated is that the publication that we're working on is for older properties. Correct. I believe prior to 2015. I think it also came out here that in 2017 we had a successful auction. So prior to that auction, the processes were followed leading up to that auction. And that is why the publication is going to only include properties that have been delinquent for a longer period of time, to ensure that those that become delinquent, since who are not individually notified, will be notified, and we will be following the law. Thank you.
Okay, thank you so much. Senator Saru?
My mic is stuck.
You having some issues over there?
I'm back.
I turned my head and you're upstanding and pulling stuff?
Yes, my mic was stuck. Morning, well, afternoon to all. Director Brady, where do you think you're going? Where do you think you're going? Where do you think you're going? There's nothing home for you, Director Brady. Okay. Sad to see you go, but thank you for your service. So let's go to a lot of things were discussed, and my list of questions continue to expand. Let's look at Attorney McLean. Morning, afternoon, non-judicial foreclosure.
You're on mute.
What are your thoughts on non-judicial foreclosure? Would it be a help to? Would it be a help to the Office of the Lieutenant Governor?
Yes, because it'll be another tool in the arsenal. And just for the record, I just want to clarify that legally, the statute allows for the first step in the auction process to be the delinquency notice in the newspaper. That is the actual law. However, the Lieutenant Governor's office, we recognize that given the number of delinquencies, it might be fairer to put in more advanced notice. And that is how the first, second, and third notice options came up, the process that will be implemented. As
so you're answering a question from the previous testifier, so I think I need to reclaim.
But I'm tying it back to you.
Okay,
but
so let's get back to me
you.
now. But good point, but my time need to go from zero.
Correct. So it will help, because now, rather than Lieutenant Governor, there'll be another level of notice, and it'll be a notice through the court. So not only do you have the newspaper, not only do you have that is specified in the law, but you will also have the 3 notices that we, as the Lieutenant Governor's office, has that we have implemented, and then you'll have this other notice that we have to give through the court process. So yes, it adds to what we're doing.
Perfect. Let's go to, I look at your personal listing, Chief of Staff, Carbon, cadastral. How many people in cadastral? Is this correct?
Could you repeat the question?
Cadastral division. How many? What's the staffing in cadastral?
The staffing in cadastral in St. Thomas.
I'm counting 2.
2. St. Thomas.
2.
2 on St. Thomas.
2 on St. Thomas. How many on St. Croix?
We have 3 on St. Croix.
Is that sufficient?
No, we're in the process of moving forward with hiring in the vacancies that were recently re-entered into the.
Okay, well, how long is that? What's we're in the process? When can we see people in cadastral? Cadastral is your weakness, you know that, right? You can admit it. It's okay to admit our weakness so we could have areas of improvement. So when do you expect to hire those in cadastral? Are you looking at the October 1 budget, or do you have funds now to hire somebody, folks in cadastral?
We have positions in the current budget for 2021.
So what's the delay? Have we been advertising the vacancies?
We good afternoon, Senator Claudette Farrington. We do have a position that Mr. Mills is getting ready to conduct interviews.
To the mic. I don't know if your mic is on.
I don't know.
Go ahead.
Can you hear me? He's getting ready to conduct interviews later this month, I guess next week.
I don't think your mic is on for media. I can hear you inside, but I don't know the public.
Yeah, media, can you check Ms. Farrington mic, please?
Hello? Good afternoon. Okay, to respond to your question, we do have a position that Mr. Mills is getting ready to conduct interviews for later this month, so I guess that would be next week. Yes.
So why are we filling the cadastral vacancy in the fourth quarter?
Well, Senator, it's been a long process. Like I said, we had vacancies that were deleted to get back some of these positions, to use critical hire funds. So it's when the funding became available for the position.
So let's talk about your appraisals then. Do you have enough people to appraise?
No, Senator.
No. How many more do you need?
Senator, I think we can do well with another 3 just for between St. Thomas and St. John.
Okay, so because I'm looking at...
That's an area we have at least one retiree.
Okay, and I'm looking at page 44 of your KPIs, and we have a lot of properties that have been fixed, refurbished, whatever. You gave a number of 70 million, 50. Let's talk about your appraisal of homes that have been repaired since the storms. You have homes from Hurricane Marilyn that you have not appraised, Director Mills.
Senator, I do suspect with the limited staff that we have, and even when I drive around, I sometimes look on the building permit list that we get from DPNR, and I figure that based on what I see, there's a lot of activity in one area that I don't see building permits coming up for. And so I do suspect that that is happening.
So we have a loss of revenue in that area, correct?
Yes, Senator.
Have you projected what a loss of revenue is to the government of the Virgin Islands? I hope the chair listening to this conversation. Go ahead. Senator,
I think sometimes it's difficult to just estimate because of the.
So what's the fallout between you? Is it the permitting process?
Say that again.
What's the teacher will just come out.
I'm sorry, Senator.
What is the loss in revenue in that area, right? What is the follow? What's happening there? Between
Senator, what is
not appraising properties that have been fixed or construction happening, and you haven't seen a permit when you go on the internet in your system, and we're losing revenue there. So
2 minutes.
What's that process? Where's the follow?
Just lack of adequate billing, because the assessment has to come before the billing, and so if you have not enough staff to do the assessment, then it leads to not enough billing because the assessment could have been higher than it actually is now.
So you're on the financial team. Have you been able to quantify what that looks like?
Senator, I've said it to both the financial team.
Saying it is not the same as quantifying the loss in revenue, because this is budget. So I stick it with numbers today. What is the loss of? Have you been able to do any assessment? And I hope the chief of staff right in his has something to do. Go ahead. So there's been no assessment.
We have not done it at that level, no, Senator.
We need to get an assessment on that. That should be a priority, because we have things getting knocked up here, knocked up there, things being fixed, and we're not collecting. The government isn't collecting their due share, and then we sit and say we don't have any money. But if we're able to fund 3-4 positions that you need, the return of investment far exceeds the cost to fund the position. Do you agree?
So, yes, Senator, because I always say that if we get $200,000 worth of positions, we can multiply that. I can guarantee that we can multiply that.
So your areas of need are cadastral and appraisals, right? Okay.
Yes, Senator.
And we also, Senator, expect a return on investment for the new CAMA system that was put in place, the new appraisal system that was put in place.
Perfect. Let's go to sewage fees. Have you made any dent on that? No?
No, Senator. We're about to just explore a cooperative agreement. Hopefully that will get somebody's attention that there's a commitment to provide us information every year, because we need to do that. There's, as you say, houses building, houses expanding, and the sewer fee, I don't think people ever connect the sewer fee with the keeping of this Virgin Islands as a tourist destination.
Well, here's the problem, and I get a little confused or stressed because you all belong to the same branch of government. So you're in harmony, not harmony. You're in harmony right now, right? So we have one division saying one thing, the other says something else, and we're losing revenue between this appraisal process, the sewage fee, and you're on the financial team. So what are those discussions within that particular area?
Well,
somebody have to say, get it done.
Senator,
right? Go ahead.
We have begun, we have reached out to them, but we can't, there's only so much we can go into somebody's place and do.
And somebody's place is waste management.
Yes, and we have reached out to them. We have offered assistance by the GIS. We have offered assistance in any way they want us to, so that we can raise the level of sewer fees that are due and payable to this government.
What is that? What was the loss on sewage fees? Have you been able to quantify that amount?
No, Senator. Until we do a reval, we would, if we did a reval, we'd be able to do much of that and be able to tell you exactly, because at that point we're not only identifying them, we then will be able to add them to the rolls.
Okay, let me go back to the Chief of Staff. Chief of Staff, you realize the areas that we're losing major revenue in? Mr. Chief of Staff, you realize the areas that we highlighted just now where we have a major loss of revenue and we're not able to quantify those losses? Because if we're talking budget, we're a revenue generating entity, we should be able to say, listen, on the appraisal side, not enough people, assessment of properties, blah, blah, blah. The government is losing 35 million a year in this area. And sewage fees, we're losing this amount of money in this area. Our corrective measures moving forward are blah, 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 blah. These are the things I expect to hear.
Yes, Senator, and we will, as you've noted, Mr. Mills is on the financial team, and we have been reaching out to waste management.
We have to get beyond the discussions and reaching out.
And we recognize that we are just the conduit for the money.
The chair of the Waste Management Board is the assistant commissioner of an executive branch in his government. Let's quickly, there's a legal publications revolving. I didn't see it. I know there was a legal publications. Do you have anything in that account? Title 3 VIC, Chapter 34. There's a revolving fund for that. That's no money in that account, right?
Time.
Legal.
Yeah, repeat which fund? I'm sorry.
It's called the Legal Publications Revolving Fund, Title 3, Chapter 34. Because people
there is such a...
Who's that? Oh. And last question, Mr.
To conclude, Senator, go ahead.
Thank you. Everybody had 40 points.
Conclude.
Okay. Last one, Director Brady.
Yes, Senator.
The captive insurance. Captive insurance falls under banking and insurance. What are your thoughts on, the captives right now are located like in Bermuda, Cayman Islands. I believe that if we revisit the whole captive discussion, I think it could generate revenue for the territory. I know there was a repatriation tax, but it was waived under President Bush. What are your thoughts on the whole captive insurance concept and reviving that and moving that?
Thank you for the question, Senator. Gwen Brady, Director of Banking and Insurance. We have one staff person who is assigned a responsibility with captives, and we are aggressively pursuing it. The only problem now is that nearly every state has a captive insurance program. And so it's no longer is it just like the Cayman Islands and mostly in the Caribbean. The states were seeing where many of their businesses were relocating too much of their operations to the Caribbean, and so now what they've done is they are setting up captive programs to the point to where NAIC is now looking at captive insurance, the whole captive insurance business, and to how it can be revamped, but we are aggressively pursuing it. We have many branch captives, not necessarily the headquarters of a captive operation, but we are researching that.
Okay. Thank you for the latitude, Mr. Chair.
Thank you, Senator Saru. Mr. Point of inquiry, Senator Francis Saliga. We're gonna be wrapping up now, Senator. So this is gonna be the last. So we have a large entity coming before us after the Department of Health. So point of inquiry.
But you remember her?
Go ahead, Senator Joseph.
Mr. Chairman, thank you so much for the time. I want to know, are you looking at automating in any way the tax clearance process? Similarly that you have done for, and it looks good based on the performance indicators for the corporations and trademarks relative to the turnaround time, as well as for the recorder of deeds. You seem to have a really fully functional automated system, and tax clearances bring in money. That's a conduit for us to bring in some money. So are you looking at automating that whole process?
And now, Mr. Laird, tax collector.
Brent Laird, I'm tax collector. Yes, Senator, we have in our plans to automate that process. It probably wouldn't happen until in the next fiscal year.
Senator Francis Saliga.
When a property is assessed, when you spoke about the sewer fees, is it assessed in regards to making sure, because I know some properties have their own septic system. Is there a difference with it being put on their bill in regards to that?
No, you're asking if, let me just restate it to make sure I understand.
Yes.
If a property is not connected to the sewer system,
yes,
are they charged?
Yes.
The answer is not initially, but eventually when they remove a truck takes it, puts it in our waste management facility, and they're charged for that service at that time. Otherwise, if you're directly connected to sewer lines, or if you come within a certain number of yards of the sewer line, you pay the sewer fee.
So basically, the question is, so it's not going to be on their bill, but they're charged if they utilize the service.
Opportunity to reduce the taxes based on damages.
Yes.
So now you need to reassess to find out whether or not those properties have been improved. Yes. So do we need, for a short window of time, to bring in a company that would be able to assess all of those companies, all of those properties that in taxes because of damage and have now been repaired?
We can explore that. We can look at that and determine if that will help us to propel forward with regards to the appraisals. Looking at any additional monies we have in the fund.
No, but if we are going to spend $150,000 to bring in a company, but it's going to realize us with $1 million, then we're not. The government is going to be generating more than we're spending.
Understood.
So we need to make. There must be a process in place. You know, a person whose house wasn't damaged and paying the fair amount, and then somebody receive an insurance settlement. The property is now worth way more, but they're paying way less. Is not fair. So we need to equalize, and we need to come up with a quick fix and then a long-term fix. The long-term fix is hiring individuals in the position, but they're going to need the training, etc. Mm-hmm. But the short-term fix would be to have a company that would come in. We look at all of the properties that receive that reduction, look at all of the properties that went to DPNR for improvement, and we assigned a task to the particular company. If you can provide us with what the cost would be, because that is going to generate additional revenues for the government. And then we need to look at fixed. We also have a lot of, the two areas where we get the most is this tax clearance and cadastral. The process for cadastral, sometimes convoluted, very suspicious at times in terms of your ability to navigate a particular office. I'm saying a lot without saying a lot. So we need to look at what is going on in there, because I think that is also an area that we need to improve. But I'm going to allow you, I thank you for your testimony, Office of Lieutenant Governor, for the work that you have done. We have seen tremendous growth in certain areas, corporation, trademarks, all of those we're seeing growth. We now just need to work on those other areas that are major revenue generators as to how we're going to get it fixed.
Yes, thank you, Senator.
So we're done for this one, Senator. We're going to go on to the next one. We have one. So closing statement.
Closing statement is simply that we thank you for the opportunity for the Office of the Lieutenant Governor to budget testimony in support of our fiscal year 2022 budget. And okay, well, we thank you for the opportunity to allow us to provide forward to receiving our funding so that we can continue to provide the needed services that we provide and to continue to collect revenues for the government.
And we thank you so much for your testimony. Definitely at a time certain, we will be following up with your real property office to see what we need to do to be able to make it fully functional, to include staffing, etc. So we're going to follow up so that we can have a discussion about those procedures that you're putting in place, and starting date and automation and everything else that would allow this government to collect more monies. So we want to thank you for appearing before us, and this committee will stand at recess for 5 minutes. The Committee of Finance is out of recess. Madam Clerk, can you read the next item on the agenda?
The Virgin Islands Department of Health and the Virgin Islands Board of Nurse Licensure invited testifiers: Justa Encarnacion, Commissioner, Virgin Islands Department of Health; Carmen Vanterpool Romney, Territorial Executive Director, Virgin Islands Board of Nurse Licensure.
Thank you, Madam Clerk. Commissioner, I'm going to allow you to put your name and title on the record, along with the members of your staff who are here in the well and those who are participating virtually. And then we'll allow the members of the Board of Nurse Licensure to put their name and title on the record. So beginning with you, Commissioner.
Thank you, Senator. I am Justa Ortita Encarnacion, Commissioner of Virgin Islands Department of Health.
Thank you so much. Next.
Good afternoon, Senator. My name is Joan Jean-Baptiste. I'm the Deputy Commissioner over Human Resources and Labor Relations at the Department of Health.
Thank you.
Good afternoon. My name is Tatia Monel Hewitt, Chief Financial Officer.
Okay, next we'll go to those participating virtually, beginning with the Assistant Commissioner, Dr. Sims.
Hi, good afternoon. Dr. Nicole Pragwell Sims, Assistant Commissioner, Department of Health.
Then I'll just go down as I'm seeing them. Mr. Callender.
Go ahead. Good afternoon. Director for the Division of Behavioral Health, Alcoholism, and Drug Dependency Services.
Okay, we are not hearing you well. If you're in the room alone, we would ask that you take off the mask if you're alone. If not, get closer to the device. Okay, say your name again, sir.
Good afternoon. Curtis Callender, Acting Director for the Division of Behavioral Health, Alcoholism, and Drug Dependency Services.
Okay, thank you. Ms. Penn? Ms. Penn?
Hi, good morning. Good afternoon. Chairperson for Virgin Islands Board of Nurse Licensure. Thank you.
Okay, the other individuals in the room there with you?
Good afternoon. Carmen Vanterpool Romney, Territorial Executive Director, Virgin Islands Board of Nurse Licensure.
Good afternoon. Arnel Lewis Commission, Board of Nurse Licensure Treasurer.
Ms. Richardson Peter?
Good afternoon. Deborah Richardson Peter, Director for Professional Licensure and Health Planning.
Mr. Steele?
Good afternoon. Renan Steele, Deputy Commissioner of Public Health.
Mr. Malloy?
Good afternoon. Ruben Malloy, Deputy Commissioner for Preparedness, Facilities, HIT, Recovery.
Ms. Wellman?
Good afternoon. Farmer, Deputy Commissioner, Health Promotion and Disease Prevention.
Dr. Hunt?
Good afternoon. Dr. Ty Hunt Caesar, Medical Director, Department of Health.
I think I'm seeing Dr. Ellis.
Hi, good afternoon. Dr. Esther Ellis, Territorial Epidemiologist, Department of Health.
Ms. Samuel.
Good afternoon. Beverly Stevens Samuel, Departmental Budget Control Officer at the Department of Health.
Spec.
Good afternoon. Beverly Herman Axley Wallace, Human Resources Director, Department of Health.
Thank you. Ms. Henry.
Good afternoon. Angela Henry, Financial Services Director at Department of Health.
Ms. Mayers.
Good afternoon. Dr. Charmaine Myers, the Maternal Child Health Director.
Ms. Holly. There is Holly.
Good afternoon.
Davis Hawley, Chief Procurement Officer, Department of Health.
Mr. Bao?
Go ahead.
Good afternoon, Donald Bow, Director of Facilities Management.
Mr. Johannes?
Good afternoon, Eleanor Johannes here, Federal Grants Director.
Dr. Esther Ellis? It's doctor too, right? I know it's two. Both Ellis are doctors? Okay. Dr. Ellis, Esther? I'm seeing you up there.
Hi, good afternoon, Dr. Esther Ellis, just Department of Health.
Ms. Charles?
Good afternoon. This is Brett Ellis, the Territorial Lab Director.
Thank you. Ms. Charles?
Good afternoon, dear Commissioner, Department of Health.
Ms. Ritter? Janiska Ritter? Ms. Ritter?
Good afternoon, Public Relations Director, Janessa Ritter.
Mr. Henry?
Good afternoon, Jason Henry, Communicable Disease.
Okay, did I skip anyone? Anyone that I haven't called, you can go ahead and put your name on the record, please.
Good afternoon, Wanson Harris, Director of Environmental Health Services.
Thank you. Anyone else?
Good afternoon. Good afternoon. Kathleen Greenaway, Disaster Recovery Specialist, Department of Health Project Management Office.
Good afternoon, Rudy Faced Out, Territorial Director, Immunization Program.
Okay.
Good afternoon. This is Dr. Mark Jerome, Medical Director for Family Planning and Acting Medical Director for EMS.
Good afternoon, Patricia Sproul, Acting Director, Infants and Toddlers Program.
Good afternoon, Lauren Concepcion, WIC Director.
Yep. That's it, Commissioner?
Good afternoon, Kevin. Good afternoon, Kevin Hodge, Director of Health Information Technology Division for Department of Health.
Good afternoon, Lorraine Benjamin Matthew, Territorial Director of Vital Records and Statistics, Department of Health.
I didn't hear Linnea Fredericks. Seems like that's it.
Okay. Okay, Commissioner, we're going to begin. I'll let you put your testimony on the record.
Thank you, sir. Good day, Honorable Senator Kurt Avila, Chair of the Committee on Finance, Senate President and Vice Chair of the Committee on Finance, Donna Fred Gregory, committee members, and all other members of the 34th Legislature of the Virgin Islands of the United States, and the listening and viewing audience. I am Justa or Tita Encarnacion, Commissioner of Health. The Department of Health appreciates the opportunity to appear before the Finance Committee today to share our fiscal year 2020-2021 accomplishments and challenges, along with the goals and objectives established to satisfy the Governor's recommended fiscal year 2022 budget. I would like to recognize Tatia Monel Hewitt, our Chief Financial Officer, and Joan Jean-Baptiste, our Chief of Human Resources, who are here with me today. Due to COVID-19 restrictions, Assistant Commissioner Nicole Cragwell-Sims, other members of the executive and leadership team are engaged virtually. I also thank all the dedicated Department of Health staff who work strong daily to improve the health and wellness of the Virgin Islands population, especially during these times. The Department of Health staff, you honestly continue to amaze me. Thank you. I would like to thank the Honorable Governor Albert Bryan Jr., the Honorable Lieutenant Governor Tregenza A. Roach, and my colleagues in the Cabinet for the support they have provided in positioning the Department of Health where we can continue to improve needed services to the community. Title III, Title 19, and Title 27 of the Virgin Islands Code prescribe that the Virgin Islands Department of Health is responsible for providing public health services to the people of the Virgin Islands, which involves protecting and improving the health of our people and our community through health promotion and preventative initiatives. Preventative measures are widely recognized as key components of efforts aimed at improving overall health and reducing healthcare costs, particularly related to chronic disease. The Department of Health functions as both a state regulatory agency and territorial public health agency for the USVI. The department has oversight of 26 programs or divisions, all of which are operational. Additionally, as the lead agency for Emergency Services Function 8 or ESF 8, the department also oversees hospitals during a declared emergency or disaster. At present, we are the lead agency during the COVID-19 pandemic while successfully providing essential health services to the public. I would like to thank all our partners, federal and local, who have collaborated so effectively to respond to the COVID-19 pandemic. Today, we will highlight key overarching accomplishments during fiscal year 2021 to date, provide an overview of the fiscal year 2021-22 agency budget program accomplishments, some key challenges, and outline agency goals and objectives for fiscal year 2021-22, guided by the strategic plan and key performance indicators. During fiscal year 2020-2021, the Department of Health continued its engagement with the Association of State and Territorial Health Officials, or ASTO, and its evaluation of our health planning process. When we came before you last year, we shared the goal of this engagement was to complete 3 products: a strategic plan, a comprehensive health needs assessment, or a CHA, and a framework for the development of a community health improvement plan, or CHIP, systematic multi-year process to improve overall health of a population. I am pleased to share that the strategic plan and the comprehensive health assessment has been or have been completed, and the community health improvement plan is in the final stages of development. The development of the strategic plan 2020 to 2025 involved all team members of the department. This was done in collaboration with key stakeholders such as both hospitals, the federally qualified health centers, the Office of the Governor, and the University of the Virgin Islands Caribbean Exploratory Research Center. Our vision is to be a trusted system that supports a healthy Virgin Islands. Our mission is to reduce health risk, increase access to quality health care, and enforce health standards. Our values speak to equity, community-focused, integrity, compassion, accountability, teamwork, inclusiveness and respect, and results-oriented performance. The comprehensive health assessment utilized secondary and administrative data sources to describe the health profile of the population and examine trends where applicable. The community health assessment guided the development of the Community Health Improvement Plan, a roadmap to improve the overall health status of the population. There is a link that you can actually tag into. It is on our DOH website, reports and plan/USVI Department of Health. The Community Health Improvement Plan, or CHIP, titled Healthy Virgin Islands 2030, aligned with the National Healthy People 2030, is designed to be a concrete blueprint for improving health for all by the year 2030. We again ensure that our key stakeholders, community health organizations such as hospitals, other governmental agencies, federally qualified health centers, and community-based organizations were at the table to provide input on our 2030 vision for the healthcare in the Virgin Islands. I would like to thank all 557 community members who took the time to complete the community survey, thus providing community input to inform selection of health priorities. The CHIP is nearing completion pending additional internal review and further input from the community. The breakdown of our budget general as well as our health revolving. The breakdown of the $28,563,000 $642 designated for General Fund 0100 is as follows. Other services, $8,538,733. Personnel services, $13,615,045. Supplies, $285,594. Fringe, $6,190,564, and capital outlay, $34,000. The breakdown of the $19,580,390,000 recurrent federal funds, or Fund 3100, covering over 31 grants, is as follows. Public service utilities, $11,000. Personnel services, $7,774,340. Capital outlay, $30,000. Fringe benefits, $3,767,409. Supplies, $4,702,119. And other services, $3,295,523. The breakdown of the $2,964,136 designated for the Health Revolving Fund is as follows. Public health utilities, $63,000. Capital outlay, $62,750. Supplies, $1,008,380. Other services, $1,830,006. The breakdown of the $1,896,954 non-appropriated funds, which include the Indirect Cost Fund, Health Casino Fund, and Emergency Surcharge Fund, is as follows. Public utility, $1,055,604. Capital outlay, $90,175. Supplies, $306,076. And other services, $445,099. There's also a chart with the breakdown of the general fund for your review, Senators. Revenue cycle management. The challenges we have encountered due to changes in daily operations resulting from COVID-19 is reflected on our anticipated collections for fiscal year 2021 with a projection of $2,800,000, which is lower than fiscal year 2020 collections of $2,894,365. Revenues as of June 30th, 2021 are $2,152,796. Business process improvement. In 2021, the Chief Financial Officer, right next to me, and her financial team continued the business process improvement with ASTO. Process improvements were later implemented in the areas of procurement, payment, processing, drawdown posting, and financial reconciliation reviews. The team continued virtual bi-weekly coaching calls and meetings with the process owners and the accounting division in which evaluations of the updated processes were conducted. Additionally, some scorecards were created to measure our progress in all the business process improvement areas by inputting data monthly in SharePoint. We identified 92 improvements in procurement, an 87% improvement in payment processing, 90% improvement in drawdowns, and 95% improvement in posting. Human Resources is going through the final phase of their recruitment process improvement training. Once the training is completed, they are expecting to have a 38% improvement in cycle time. We were able to take advantage of the improved processes and good teamwork by the division's leads and Center for Disease Control and Prevention partners. The Department of Health spent 97% of the Crisis NOFO award, and that is the post-hurricane grants that we were given, totaling $4,284,949. To continue the sustainability and improvement, we will provide ongoing and refresher trainings and conduct quarterly meetings with programs for feedback on challenges, successes, and recommendations. In addition, the SharePoint files will be continually updated to ensure new employees have access to our standard operations procedures, checklists, and training plans. Finally, we will hold biannual process owner sponsor meetings to review and update processes consistent with the policy changes. Overall, the business process improvement was a great success. We were featured in a March 2021 ASTO newsletter under quality improvement for our great work. Below is the actual statement that was taken out, sir. Lastly, Chief Financial Officer Tatia Monel-Hewitt gave an outstanding presentation on June 24, 2021 at the ASTO webinar titled Unlocking Possibilities Through Process Improvement to Chief Financial Officers, Deputy Commissioners, ASTO, and CDC in the mainland. I would like to thank the process owners and financial team for their contribution, hard work, and dedication in making the entire process more efficient and effective. The Office of Procurement and Contracts Management and Reporting, or OPCMR. The OPCMR and reporting was created pursuant to Executive Order number 493-2019 and facilitates the procurement process for goods and/or services as well as leases for the department. OPCMR ensures adherence to all of the established policies and procedures of the Virgin Islands Department of Property and Procurement in a centralized manner. Having all requests submitted to a central location allows for the uniform collection of required documents and overall control for resolutions of any issues. The OPCMR reviews quotes and solicitation, drafts agreements, facilitates the execution of lease agreements with the Department of Property and Procurement, gathers corporate documents from vendors, liaises with Department of Property and Procurement on all procurement for the department. Since the establishment of the OPCMR, the department has participated in approximately 8 GVI-wide contracts with various vendors for services including but not limited to janitorial, terminating, purchase of household cleaning services and supplies, security systems, and/or guard services. The unit has also coordinated efforts with DPP to approve agreements that are attached to monthly recurring charges for fiscal year 2021, approximately 15 to 20. The same will be done for fiscal year 2022. The coordinated effort also resulted in the execution of 30 to 40 contracts department-wide. Some of the agreements were 3 to 6 months, so have expired, but were nonetheless executed. Currently, there are 84 items on the list of pending agreements, solicitations, and vendor pending leases that the unit is working on. There are 3 executed leases, 1 on St. Thomas and 2 in St. Croix. The Office of Federal Grants. The Office of Federal Grants is presently overseeing 65 projects with 85 single budget totaling $66,007,900. Since the pandemic, the department has been awarded 21 individual COVID-19 grants totaling $25,910,728. The awarding programs are epidemiology, lab capacity for infectious diseases, Ryan White Care Act Title II, immunization vaccine program, maternal child health or MCH program, mental health and substance abuse services, public health emergency preparedness, and the national initiatives to address COVID-19 health disparities among population at risk and the underserved, including racial and ethnic minority populations and rural communities grant program. Nationally, the COVID-19 grants were all afforded extended program periods to address the need of the community and to be able to acquire the vaccines and supplies needed. Again, due to the COVID-19 pandemic, our regular grants were afforded extended authority. Extended authority allows this portfolio of grants to expend their funding until it is done. Every program that has federal funds had to request this authorization from their respective grantor agency. The Virginia Department of Health has had no returns of any federal funds for this fiscal year. Because health funding is critical and crucial to the well-being of the community, our grants have been allowed carryovers for funding that were unobligated. The VI Department of Health has one restricted grant in its portfolio, which is the F7078 State Primary Care Office or PCO grant worth $150,464. This grant is restricted because the central government did not receive its new indirect cost percentage. Department Fiscal Year 2019-2021 accomplishment. The Bureau of Human Resources and Labor Relations is responsible for the management and development of employees through the agency. We play a significant role in effectuating efficient operations by continually recruiting, onboarding, supporting, payroll, employee benefits, performance management, training and development, labor relations, and compliance. The goal of HR this upcoming year is to increase the level of efficiencies throughout the agencies by improving the functions of the HR division, which impacts the entire department. Accomplishments. Led the recruitment efforts for the territory for the COVID-19 mission. This includes JFL, SRMC, private sector vaccine providers, and long-term care facilities. Recruited and onboarded 58 team members to the Virginia Department of Health, 26 part-time, 32 full-time employees successfully onboarded to include behavioral health staff, regulatory and compliance, maternal child care health, Office of the Commissioner, Federal Grants, Epidemiology, Maintenance, Virginia's Board of Nurse Licensure, Vital Statistics, and Epidemiology. Reduced number of labor relations grievance by 27% for fiscal year 2022, 3 PERP cases included. 2021, 3 cases included. Continued engagement with ASTOS to streamline the recruitment process. Our statistics: number of employees in St. Thomas, St. John District, 220, St. Croix, 204, with a total of 424 employees. Number of exempt employees, 46 on St. Thomas, St. John, St. Croix, 62, total 108. Number of separations in fiscal year 2021, 11, based on resignation, retirements, and other separations. For vacancies, federal, we have 23. General fund, we have 54. All staff, we have 4 staff currently in active role that we're working on. Emergency medical services, total actual staff as of 6:30, 19 EMT basic, EMT paramedics 8, and 10 intermediate. Fiscal year 2020 goals continue with the 3-week projected onboarding of HR coordinator. Will implement performance evaluation process throughout the agencies. Fully developed criteria-based job description process in alignment with the Division of Personnel. Implement Public Health 101 trainings through Region 2 Public Health Training Center at Columbia University, Mailman School of Public Health, with assistance from our CDC Public Health Assistant staff, which is it's a PHAP program from CDC. The Bureau of Health Statistics. The Bureau of Public Health Services. Behavioral Health, Alcoholism, and Drug Dependency Services, or BHADS. The Division of Behavioral Health, Alcoholism, and Drug Dependency is charged with the provision of substance abuse and other behavioral health services throughout the territory, including Barbell Plaza Outpatient Clinic, the Charles Howard Complex Outpatient Clinic, the Morris de Castro Outpatient Clinic, the Methadone Clinic, also located at the Charles Howard Complex, the Clubhouse, and our 32-bed co-ed psychiatric facility, the Eldra Shelterbrun Residential Facility. Of and has clinical and financial responsibility for patients at off-island residential facilities. This includes BHADS patients who demonstrate a need for residential treatment, general community members who are taken to court as a result of a pattern of unstable and dangerous behaviors and are thereby court-ordered into residential treatments, otherwise known as 722s and 723s, involuntary commitment status. Inmates of the Bureau of Correction who are found to need residential treatment and clients of the Department of Human Services who are turned over to the Department of Health for case management, psychiatric care, and payment upon aging, turning 18 years of age. The division is recognized as a top priority clinical service area supported by the Governor's Executive Order 486-2019. There are various key accomplishments of the division since July of 2030. These accomplishments included psychiatric services accompanied by some of the private entities. It is actually extensive, but I will continue to read until Senator VLA tells me not to. Key accomplishments of the division: implementation of psychiatric telehealth services for our patients through a contractual relationship with Island Therapy Solutions and Beautiful Dreamers. Collaboration with the Federal Emergency Management Agency, or FEMA, and Substance Abuse Mental Health Services Administration, or SAMHSA, to implement a community resiliency project in the territory in conjunction with two local partners, Island Therapy Solutions and Insight Psychological Services. It is a crisis counseling program available to all individuals in the territory, helping our community understand their current situation regarding the pandemic and reactions, reducing stress, and providing emotional support, promoting the use of the development of coping strategies, and connecting individuals with other people and agencies who can help them or provide support. Onboarded 3 new staff members at the clubhouse and 5 new staff members at the Charles Howard Outpatient Clinic, including a clinical supervisor, clinical therapist, case manager, and mental health worker. BHATS provided an outreach and education series to Synchro Educational Complex high school students through November and December. BHATS participated in various community programs, including conversations with AARP to provide emotional support. BHATS received 3 mobile outreach vans from for the territory, 2 31-foot unit for St. Thomas and St. Croix, and 1 20-foot unit for St. John. The training for operation of the mobile units will be held in August of 2021, provided by Lifeline Mobile. We are scheduled to have an official announcement of the vans and services that will be offered later that same month, with the implementation of the already developed outreach schedule for the use of the vans. BHAT was heavily involved in the collaboration with former Senator Jackson's office and other community stakeholders regarding the establishment of the direction of the Office of Gun Violence Prevention. BHAT had a successful SAMHSA virtual site visit substance abuse block grant. For the onset of the pandemic, BHAT has provided several programs and presentations for the government of the Virgin Islands, beginning at home with the Department of Health, including the Breathing Clinic, Impassioned Compassion, Compassion Fatigue, and Self-Care, and Stress Relief at the Workplace. Provided self-care workshop for the Department of Education's primary school teachers, outreach services that took place both in person and virtually to include counseling related to fear and emotional challenges in the pandemic, provide grief counseling to the Sports Park and Recreation, the Office of the Governor, Emergency Medical Services, and beyond, increase collaboration with the Department of Human Services regarding case management, adult protective services, and Medicaid services, implemented several new member trainings at the clubhouse. The clubhouse actually sees 6 to 10 clients served weekly, 14 clients served by virtual wellness checks via phone because of their hesitancy and discomfort to return in-to-person services. BHAT staff collectively has done a phenomenal job at participating on online trainings, demonstrating significant commitment to remaining abreast of advancement and best practices in the field to offer best care possible to our consumers. Continued involvement in interagency collaboration with VIPD, DHS, Office of the Governor, etc., to assist and relocate homeless patients or houseless patients. Residential patients services. 3 patients returned to the Virgin Islands, 1 completely released from court supervision, 3 patients reunited with family, 1 transitioned to the independent living, and 1 successfully admitted to the residential for more restricted care and successfully discharged back to St. Croix. Outreach services continue. Despite all only having 1 outreach worker, territory-wide, the division has been able to have a great deal of outreach encounters over the last year. These encounters have included outreach education and events, assisting in crisis intervention, assisting in carrying out 722s, and assisting in houseless encounters or resource linkages. Between September 2020 and June 2021, there have been a total of 717 encounters. Please note that some of the categories of the encounters overlap, creating a seeming inconsistency with the total. For example, a 722 or a commitment will account as a crisis intervention, but not every crisis intervention will be a 722. Our goals and plans for BHADS, including, for example, expanded the services of the division, including in-house psychiatric services in both districts, adding key personnel, case managers, clinical therapists, outreach workers, and nursing staff, and implementation of the mobile crisis team. We additionally plan to move towards phasing out the methadone program as a freestanding clinic and integrated medication-assisted treatment into the regularly outpatient clinics. As it pertains to Anna's Hope, the Department of Health intends to submit a formal request to the legislature requesting to utilize appropriate funding for the architect and engineering as a necessary step to begin construction. The proposed residential facility would also have separated space to provide both partial hospitalization program and day treatment services. Emergency Medical Service, or EMS. The Virgin Islands Emergency Medical Services is committed to providing the highest quality emergency medical pre-hospital care to our citizens. On a daily basis, staff members are called upon to enter the unknown. At times, care provided goes beyond the medical, and mediator roles between family members regarding the issues at home at hand become more prevalent. They meet patients who are at the worst moment and the worst days of their lives. As first responders, they can expect to respond to emergencies on land, sea, or near water, never knowing what they will find. The fact remains, however, they are always ready and proud to serve. Emergency services vehicles. In St. Thomas, St. John District, we have a total of 22 vehicles, 3 of which are in St. John, 14 on St. Croix. With 800 individuals living, we're going now to our communicable disease. With 800 individuals living with HIV in the USVI, the Communicable Disease Division remains focused on the vision and slogan, 340, Getting to Zero. The slogan was adopted in collaboration with the proclamation signed by Governor Albert Bryant in July of 2020, making July HIV Awareness Month in the U.S. Virgin Islands. The goals of the 340 Getting to Zero campaign are 90% of the people living with HIV knowing their HIV status. 90% of people who know their HIV status will be receiving treatment. And finally, 90% of the people on treatment having suppressed viral loads. In calendar year 2020, the USVI had 13 newly diagnosed HIV cases and 16 individuals who were previously diagnosed in another jurisdiction relocated to the territory. We have had 4 new cases thus far for calendar year 2021. Additionally, the division provided direct services to 188 HIV positive clients in 2020. 82 clients with HIV received medication via Medicaid, 52 received full payment medication via AIDS Drug Assistance Program, and 54 received medications through co-pay medications assistance program. As of the 188 individuals enrolled in care, 70% of them are virally suppressed. I'll reread that. Of the 188 individuals enrolled in care, 70% of them are virally suppressed. Viral suppression is the act of HIV medicine reducing the amount of HIV in the body or the viral load to a very low level or undetectable number that goes back to 340, getting to 0. Thus allows the immune system to keep working, prevents illness, and if the viral load is undetectable, it eliminates risk of transmission of HIV during sex. Percent of viral suppression. This gives you an idea of how the viral load sometimes shifts back and forth. January 2017, 71.49%. January 2018, 72.40%. January 2019, 75.51%. January of 2020, 68.22%. And January of 2021, back up to 73.64%. One of the Communicable Disease Division's key performance indicators speaks to the expression of viral loads. Like many districts across the nation, the Communicable Disease Division reached a speed bump due to COVID-19. However, the division quickly adapted to ensure continuity of services while meeting grant requirements. The Communicable Disease developed processes to provide rapid COVID-19 screening to HIV-positive clients while supporting the EPI division with COVID-19 screening to the general public. In June of 2021, the division was recognized by Primary Care Development Corporation in the New England AIDS Education and Training Center for adopting a unique initiative during the pandemic by offering pop-up and drive-through COVID-19 and HIV testing. As a result of this recognition, the Communicable Disease Division was asked to present during the My Test, My Way Lessons Learned and Innovations in the HIV Testing National webinar to other health departments and community-based organizations on an innovative testing strategies. Keeping on the trends of being innovative, the surveillance unit became the first in the nation to fully implement our data reporting system on a secure cloud-based, making it accessible remotely while ensuring continuity during man-made natural disasters. Notably, the Communicable Disease Division was recently awarded supplemental funding for the development of a disease intervention workforce to combat current and future epidemics. The Bureau of Regulatory Services. DOH's regulatory oversight services include birth and death certificates, burial permits, funeral homes, tobacco control, medicinal marijuana control and regulation, food safety, certificate of need, medical malpractice clinician, and allied health licensing, and professional boards and related health data collection. The Department's Division of Environmental Health works to protect the community's health by permitting and regulating restaurants, retail food establishments, hotels, beauty salons, barbershops, tattoo parlors, spas, schools, daycare, and early child care education centers. The division also investigates environmental health complaints and outbreaks. The two main activities are food safety and general sanitation. Our accomplishments. Health inspectors completed mentorship training with the National Environmental Health Association. Health Space Electronic Inspection System has been implemented. Developed 12 division-based protocols on environmental health operations. Secure IT infrastructure to conduct cloud-based inspection and in real time. Staff was able to complete training in cosmetology safety, pest control, tattoo parlors inspection, plumbing code, and customer service. Environmental health obtained an additional peace officer in St. Croix in April of 2021. Challenges. Scope of work has increased since the pandemic, resulting in increased mitigation efforts. Lack of adherence to COVID-19 guidance and DOH regulations or protocols. Enforcement personnel meeting the increased demands for coverage. Despite that, we have goals. Our goals implement new fee schedule for administrative fees, which will project approximately $5 million into the health revolving fund. introduce and mandate the enrollment of Serve Safe, a nationally recognized and American Standard Institute certified course on food safety and best practices for one to obtain a health card. Implement the National Environmental Assessment and Reporting System, which is a surveillance system used to capture environmental assessment data from foodborne illness outbreak investigation to improve the division's food safety program. Our Division of Professional Licensure and Health Planning. The Office of Professional Licensure and Health Planning continues to charge to maintain the public's health and safety through licensing regulations for 9 health professional boards and administration of the territory's Certificate of Need and Allied Health programs. The current boards are the chiropractic, dental, medical, optometry, pharmacy, physical therapy, podiatry, psychology, and veterinary medicine. 13 different license types are vetted through these boards. There has seen a marked increase in licenses issues, increasing access to healthcare services. Board members continue to maintain active relationship with the Federation boards, keep abreast of current trends and standards, and help shape nationwide policies. Professional license collaboration continues with many inter- and intra-governmental agencies and looks forward to realizing license automation for all boards. The goal, upon the initial CON or Certificate of Need award, follow-up surveys will be conducted by the Regulatory Division to ensure clinical and life safety requirements are met rather than annual CON renewals. And the goal is to submit an RFP proposal for CON application update. The Immunization Division. The U.S. Virgin Islands Immunization Program serves as a regulatory component of the Department of Health that aims to prevent and reduce the risk and incidence of vaccine-preventable diseases for all Virgin Islanders. The goal of the immunization program is to prevent, promote, and protect through education and collaboration to eliminate vaccine-preventable diseases in the United Virgin Islands. The program provides access to vaccines for children enrolled healthcare providers at no cost, enforce school and child care immunization regulations, provide immunization education and training for healthcare providers and the public, coordinate surveillance and control efforts for vaccine-preventable diseases, promote vaccine safety, and develop effective partnerships. The VI immunization program is charged and with the responsibility of ensuring uninsured and underinsured population receive vaccination to prevent disease, disability, and death. The immunization program is 100% federally funded and works cohesively with the Center for Disease Control and Prevention to ensure vaccines in the territory are up to date, administered properly, empower providers to increase vaccination, and work to change the perspective of providers who do not administer certain vaccines, for example, the HPV vaccine, address vaccine exemptions and hesitancy, and utilize purpose-driven messaging to creatively communicate importance of vaccines via a cross-section of resources. As of 2018, the immunization program officially ended direct public services by becoming a regulatory constituent within the Department of Health. This means that the immunization program no longer administers vaccine, but has transferred that responsibility to community health and maternal and child health clinics. The immunization program supports these and other participating healthcare centers by supplying vaccines for patients who are underinsured and uninsured, and by annually surveying the providers for compliance and federal guidelines. Accomplishments include instrumental in positioning the territory to receive COVID-19 vaccines simultaneously with the United States. With the availability of COVID-19 vaccines in the U.S. in December of 2020, states and territories were obligated to plan the receipt, distribution, and administration of the first vaccine in their population. Register 37 public and private health care providers, including pharmacies and federally qualified health centers, to participate in the COVID-19 vaccination program. I would be remiss if I did not thank the following entities: the University of the Virgin Islands for their assistance by permitting the department to use their ultra cold storage unit on St. Thomas as a vaccine hub, the VI National Guard for assistance with vaccine distribution and management, by TEMA for their support and logistics, and our federal partners included FEMA and the CDC for practical and technical assistance, not to mention the fact that we actually were housed at the University of the Virgin Islands for our COVID vaccine community centers. The immunization program ensured the equitable dissemination of all COVID-19 vaccines once they became available, Pfizer, Moderna, and Janssen, or the Johnson & Johnson. The program worked closely with the Vaccination Task Force to make COVID-19 vaccines available to the public. Mass Vaccination Clinic, or CVCs, Mobile Vaccination Strike Team, pop-up vaccination efforts, outreach efforts, and public education were instrumental to sustaining equitable access to vaccine and remain active today. Maintain consistent system development for the Virgin Islands Immunization Registry System, or VAERS, a cloud-based system reestablished in January of 2020, closer to achieving complete connectivity to healthcare provider electronic health record, where information will be automatically exchanged. Challenges: significant reduction of annual general vaccination for adults and children due to onset of COVID-19. Programmatic activities related to vaccine for children were not prioritized with the focus on COVID-19 vaccination response efforts. Immunization vaccine efforts were postponed to 2021 season due to significant reduction of public response following the availability of COVID-19 vaccines. Our goals include finalize a data use agreement by July of 2021, which will allow bi-directional data sharing with CDC, which makes the division eligible for continued funding to support system enhancement. Receive legislative approval for language of development by the program that will provide accountability for healthcare providers reporting of patient data occurrences. The legislation will also clarify jurisdictional mandates for children, adolescents, and college-bound vaccinations prior to starting school. Relaunch the influenza campaign in October 2021, and resume uptick of healthcare provider participation in the Vaccine for Children program. Vital statistics. The Department of Vital Statistics, Office of Vital Records and Statistics, is mandated by the VI Code of Register and preserve data relative to all vital events in the territory of the Virgin Islands of the United States. VRS is responsible for the registration, maintenance, and dissemination of the territory's birth and death records. Birth records shows that in October 2020 to July of 2021, St. Croix had 37 births. St. Thomas had 397 births, and St. Thomas had 257 deaths. St. Croix, 333 births and 297 deaths. In totality, total was 730. And in St. Thomas, 551. That is in reference to, of course, the St. Thomas births. The VRS revenue generated as of June 2021 is $100,051.11. Accomplishments: implemented a new birth certificate template in November of 2020. A request for proposal was submitted for a vital records information management system. A vendor was selected and the cost finalized. VRS applied and received $200,000 grant from CDC to assist with the death registry. The 2020 live birth standard certificate of deaths and fetal death information were scanned, uploaded to SAM.gov, and sent to National Vital Stats System. The Department of Health will be reimbursed for the data sent to NCHS. The USVI Department of Health, VRS, and NATRO and CDC, the project partners, conducted 11 training, 2 in-person and 9 virtual trainings to USVI professionals. This project focused on increasing the capacity of VRS to improve the disaster-related death reporting capabilities for USVI professionals with responsibilities and authorities for completing or processing death certificates, including first responders, coroners, funeral home staff, and physicians, healthcare facility staff, USVI Department of Health staff, and staff from other USVI governmental agencies. The challenges: the scope of work have increased since COVID-19 pandemic. Goals: clean and digitalize all VRS records by 2021 December. Sustain online submissions of application for a certified copy of birth or death record by January of 2021. Implement a new death certificate template by November of 2021. Increase fees for all certified documents at VRS by November of 2021. Increase the registration of birth and death within 5 business days as received to 85% by September of 2021. Ensure both hospitals submit data electronically by December of 2021. The Bureau of Health Promotion and Disease Prevention. The Bureau of Health Promotion and Disease Prevention includes the Chronic Disease Program, community health clinics, to include Morris DeCastro Clinic on St. John, Family Planning Program, Infants and Toddler Program, Maternal and Child Health and Children with Special Needs Care Program, Primary Care Office, Public Health Laboratories, Women and Infants and Child Program, or WIC. The Chronic Disease Program. We have identified chronic disease, by the way, as our top priority for FY 2022. Accomplishments in chronic disease. The USVI Department of Health executed a contract with Louisiana State University, or LSU, to resume the Behavioral Risk Factor Surveillance Survey, or the BREFIS, the first time the survey is being conducted since 2016. During the month of May, 130 surveys of the proposed 20,000 have been completed. You will receive a call from the VI Department of Health. We ask that you accept the call. The VI Department of Health Chronic Disease Program subgrantee, the Sickle Cell Disease Parent Group, sponsored a candlelight walk on June 19th of 2021, World Sickle Cell Day, to raise awareness about sickle cell disease. A key objective of this group will be working with the Department of Health and community partners to develop a sickle cell registry. Plans for the final quarter of this fiscal year include offering free testing at local labs and an educational awareness campaign during September of Sickle Cell Awareness Month. The Cancer Registry secures support from a vendor to improve data abstraction to facilitate submission of data and national program of cancer registries. A cancer registrar was hired and is in training to become a certified cancer registrar, improving sustainability of the registry. The department successfully executed a contract with the University of Utah to conduct data collection for its cancer registry. Chronic Disease Program staff coordinated and implemented 6 media campaigns, numerous outreach activities towards addressing chronic disease prevention efforts in the USVI. The program manager hired in February of 2021 successfully expended over 90% of the crisis NOFO, Notice of Funding Opportunities funds for the asthma project, resulting in a mural, a multimedia campaign, an extraordinarily successful virtual webinar with presenters from EPA and CDC. Our community health clinics in St. Croix, St. Thomas, and St. John during fiscal year 2021 have been instrumental in the rollout and implementation of the COVID-19 vaccines through community health clinics and community vaccine centers, established on all 3 islands since the arrival of the vaccines in the territory in December of 2020. By the end of June 2021, 33,821 vaccines have been administered through the CVCs. Additionally, regular clinic operations continued using telemedicine in an in-person way safely. Clinic providers in both districts served over 2,000 clients and conducted 9 community health outreach events. The goal is to work with the Chronic Disease Program and MCH in the development of a diabetes registry to better capture data, assessing findings, and apply programs for processes to prevent increased number of diabetics in the territory. We are actually actively working right now with the University of Virgin Islands to submit for a grant for the diabetes registry. Family planning program. From October 1st, 2020 to June 30th, 2021, the family planning program has served 2,077 clients and submitted all required reports, continuation grant application to ensure continued funding, including approval of $160,000 carryover in supplemental funds to support IT infrastructure upgrades. Our infants and toddler program. The program met or exceeded 88% of our key program indicators. Maternal and child health and children with special care needs. Despite the onset of COVID-19 pandemic, the maternal child health and children with special health care needs, MCH and CSHCN provision continues to provide pediatric services to children and children with special health care needs between ages 0 and 21 in the territory. These services include pediatric newborn, high-risk special needs pediatric clinic, social services, immunization, audiology, physical therapy, speech pathology, neurology, and neurology services. Accomplishments. Successfully contracted with the Caribbean Exploratory Research Center of the University of the Virgin Islands to complete the MCH Title V and Maternal and Infant Early Childhood Home Visiting Program Needs Assessment and numerous health campaigns. Produce notable virtual campaigns to include Let's Get Active obesity prevention campaigns, reaching over 12,000 families on the first night and over 1,000 each week via Facebook. The oral health campaign conducted in collaboration with the American Dental Association, reaching over 500 children territory-wide. Let's Talk Nutrition Talk Show, featuring your panelists and staff from WIC and MCH, and a virtual Let's Cook VI-style cooking activity. They conducted a mental health awareness campaign offering the Through the Stages of a Child trunk or treat event and a building conversations around children mental health. Collaborate with the Northeast Caribbean Mental Health Technology Transfer Center to host a youth mental health first aid training at home visiting nurses. Conducted a Relax, Relate, Release Educators Mental Health Matters. Also worked with the Let's Talk Youth Mental Health Program. Highlight of the month's activities include a drive-in movie night hosted in St. Thomas and St. Croix that reached over 500 families. Reading with a Purpose activity integrated attention to both mental health and wellness through specific themes presented in the work of USVI and Caribbean authors, and virtual parent cafes hosting 27 families. Successfully conducted the Early Hearing Detection Intervention Program and they screened 72 children in Early Head Start program. The division continues to see children, both Zika positive mothers, through a neurologist that travels to the territory on a quarterly basis. We are pleased to report that the telehealth equipment has begun to arrive in the territory. Plans are underway to conduct second Zika Health Brigade scheduled for the months of July and August, including the use of telehealth equipment. Our primary care office. The U.S. Virgin Islands Primary Care Office increases access to quality health care through assessment, collaboration, and workforce development. The PCO is 100% funded through a cooperative agreement with the Health Resources and Services Administration for $150,464. The funding is authorized by Public Health Services Act as amended Title III, Sections 330 and 333. The three broad areas of activity covered by the PCO are statewide and territory-wide primary care needs assessment, shortage designation coordination, and technical assistance and collaboration that seeks to expand access to primary care services. During fiscal year 2021, the Primary Care Office has accomplished all goals and objectives, including completing and submitting the U.S. Virgin Islands Primary Care Needs Assessment, which will be utilized for public health decision-making and coordination of statewide rational services area for. In addition, the PCO provided information session and technical assistance to primary health practices eligible for National Health Services Corps site certification. This resulted in various sites being recertified and first private provider site in the territory achieving national NHSC new site certification. The territory currently has 7 National Health Service Corporation loan repayment program participants and 1 National Health Services Corp scholarship participant program participant. The PCO collaborates with the University of the Virgin Islands School of Nursing to educate nursing students about scholarship and student loans repayment opportunities through the Nurse Corps scholarship and loan repayment programs. Through collaboration with the Office of Professional Licensure and University of Albany School of Public Health, the PCO has conducted comprehensive surveys of physicians and dentists. The data collected is being used to facilitate health planning efforts and maintain accurate records in the shortage designation management system, which impacts the territory's opportunities to receive federal resources as a health professional shortage area. Territorial Public Health Laboratory. The Public Health Laboratory has been essential to the territory response to COVID-19 pandemic. The laboratory was successfully inspected by CLIA, the Certificate of Compliance, for the first time. And I go back to say they obtained a Certificate of Compliance for clinical patient testing. This is our first certified public health in the territory. This has resulted in a substantially improved capacity for high complexity testing and advanced molecular and automated testing that was not previously available in the territory. The laboratory has also provided significant external support, provides training and distributed equipment and over 75 tests to local providers. Over the last year, the laboratory has provided support for over a dozen external clinical labs and organizations, including the Bureau of Correction, Human Services, and schools. Territory-wide laboratory testing has increased significantly during the pandemic, and to date, there has been over 138,000 tests performed for COVID-19. The laboratory has also provided daily support for vaccine storage and distribution, community testing events, and regular radio interviews. Women's, Infants, and Children, or WIC. The Virgin Islands Special Supplemental Nutritional Program for Women, Infants, and Children is 100% federally funded nutrition program for the Food Nutrition Services of the United States Department of Agriculture. The program provides supplemental foods and nutrition education at no cost, as well as referrals to other healthcare and social services programs and agencies to eligible participants. WIC participants are low-income pregnant, breastfeeding, and non-breastfeeding postpartum women, infants, and children up to age 5. Key accomplishments for FY 2020-2021 include continued to maintain the highest breastfeeding rates in the nation, achieving a 70% infant breastfeeding rate, a 9% increase over the 2020 rate of 61, and 85% breastfeeding rate for women, an increase of 7% compared to 2020, and a rate of 12% for fully breastfed infants, an increase of 1% over 2020. Maintained WIC food vendor integrity by conducting vendor monitoring at 100% of WIC vendors. National regulations indicate do monitor about 5%.
Okay, Commissioner, I'm going to ask you to skip the accomplishments in the essence of time.
Yes, of course. I was waiting for you. Ready? Epidemiology. I will go through epidemiology thoroughly.
Yes.
Okay? The division collects surveillance data to identify, prevent, and respond to current, emerging, and unknown public health threats in recent years. The division has assisted the Department of Health and partners in detecting and responding to a variety of public health issues, including chikungunya, Zika, norovirus, salmonellosis, leptospirosis, melioidosis, and most recently, COVID-19. Federal funds for the program has increased significantly and is currently supported by the federal grants from the CDC Epidemiology and Laboratory Capacity for Infectious Disease. Grants. The epidemiology program is currently funded by federal grants. Typically, the amount awarded under the ALC mechanism is expected to be approximately $1.5 million annually. However, there were significant funding over the last year because of COVID-19 outbreak and availability of supplemental awards. Epidemiology is a branch of science that deals with the control and prevention of communicable diseases in a community. The Epidemiology Division of the Virginia Department of Health is a crucial component in the following service areas: investigating, intervening, and monitoring the occurrence of illnesses in the USVI, monitoring notifiable diseases reported by healthcare professionals and assisting them with case management, providing education and consultation of healthcare professionals, community group, and members. EPI had been there for the public and will continue to be driving force for public health in the U.S. Virgin Islands. In 2019 and beyond, EPI continues to build on joint efforts to respond rapidly to emerging health threats, modernize interdepartmental data sharing, and establishment of territory's first public health laboratory. EPI primarily coordinates infectious disease epidemiology across territory. Currently, EPI is made up of General Epidemiology Program, the Vaccine Preventable Disease Surveillance Program, and Influenza Surveillance Program, the U.S. Zika Pregnancy Registry Program, and the COVID-19 Task Force. Clinical services. Epidemiology does not provide any clinical services at the current time. However, it does provide pop-up testing for COVID-19 and blood draws for mosquito-borne viruses as needed and supports specimen collection as needed. For the COVID update, as of Tuesday, July 20th, we have conducted 138,912 tests, of which 4,249 have tested positive, 134,663 have tested negative. Currently, we have 165 active cases territory-wide, 59 active cases on St. Croix, 101 active cases on St. Thomas, and 5 active cases on St. John. Our 7-day positivity rate continues to fluctuate, but it is currently at 4.13%. Unfortunately, there have been 33 fatalities related to COVID-19. All of the deaths were among unvaccinated individuals. Additional news to our COVID report. The Department of Health has received confirmation from Yale University that the Delta variant of COVID-19 has been identified in the territory and will continue to push to get the Virgin Islanders vaccinated. I repeat, the Delta virus has been officially identified in the territory. We received that news yesterday. We indicated last week that we had a suspicion, and our suspicion was confirmed. The Department of Health Division of Epidemiology has been working with Yale University to test samples for COVID positive cases. Thus far, 84 samples have shown to be variants from sequencing. Of 84 cases, 65 have been of Alpha variant, which is also known as the UK variant. 6 samples have been Iota, or B1351 beta, and 1 sample, Epsilon B1429. Preliminary results show 12 samples were not confirmed to be any of the variants that have been previously identified in the territory. Full sequencing results now show that 2 of the 12 samples not previously identified in the territory are confirmed to be that of the Delta variant. And I repeat, our hospitals continue to provide acute and critical care management of individuals presented with moderate to severe COVID-19 illnesses. The current number of hospitalizations are 20, 7 at JFL, 1 vented, 13 at RLS, with 1 vented. The hospitals also serve as the outpatient infusion centers for SARS-CoV-2 monoclonal antibodies, or MAB, infusions. The MAB infusions are offered to individuals with mild disease who do not meet hospitalization admission criteria but have underlying risk factors that may cause progression to advanced diseases. MAB infusions act as a prevention to advance COVID-19 related disease. It does not prevent COVID related disease. You already have COVID disease, and monoclonal antibodies are infused to prevent death and high hospitalization with attention to critical care. Even though this medical countermeasure has saved many lives and has prevented hospitalization, the vaccine is the safest and most secure way of reducing risk, reducing transmission, and saving lives, not just today, but in the future as we continue to fight the pandemic. So far, we have administered 212 monoclonal antibodies infusions at Snyder-Reader Medical Center, which also includes Myra Keaton and St. John. In June, 78 individuals received monoclonal antibodies, and in St. Thomas, thus far, 76 have been administered in July and counting. 48 monoclonal antibodies infusion have been administered in Wang Lui Hospital. A total of 8 were administered in June, and thus far, 18 were administered. Bureau of Facilities and Capital Projects. Our preparedness, our funding, Hospital Preparedness Program Cooperative Agreement. This is public health services or public health preparedness services. Hospital Prepared Program. The HHP COAG is a 5-year program funded by the Assistant Secretary of Preparedness and Response. The focus of this funding is to improve patient outcomes, minimize the need for federal and supplemental state resources during emergencies, and enable rapid recovery from catastrophic events through the development of healthcare coalitions. This program focuses on the 4 capabilities: funding of healthcare and medical readiness, healthcare and medical response coordination, continuity of healthcare services delivery, and medical surge. Funding from the program has been issued to pay core staff salary, purchase equipment for the hospital and for the division, purchase personal protective equipment, as well as provide training opportunity to both hospital employees. The Healthcare Coalition. The division is currently working on establishing the operational in the Virginia's Healthcare Coalition. The Healthcare Coalition are groups of individuals, healthcare, and response organizations in a defined geographic location. They serve as multi-agency groups that support and integrate ESF-8 activities in the context of Incident Command Systems, or ICS, responsibilities. The coalition will also help to solidify a strategic plan for the hospitals and public health system to follow in strengthening the hospital system within the territory. The Public Health Emergency Preparedness Co-op Agreement is a 5-year grant program funded by the Center for Disease and Prevention. The focus of the funding is to support strengthening the capability of public health systems to effectively prepare for a response to public health threats and emergencies. This program is built on its 6 domains of preparedness: community resilience, incident management, information management, countermeasures and mitigation, surge management, and biosurveillance. Emergency Support Functions 8, Public Health Medical Services.
Okay, before you continue with that one, Commissioner, so that we can get to some of the budgetary questions.
Okay.
You're very comprehensive as usual. I'm going to ask you to go, colleagues, for you to go ahead and continue reading. It's a lot of information that would allow us to learn what is going on with Department of Health. But at this time, I'm going to ask the Commissioner to just go to the summary and the conclusion, and then we'll come back.
Okay. And I know that you will be asking a lot of questions about our, and that's the end.
Right. I saw that with the disaster recovery, and I'm sure that we're going to pull you before the disaster recovery committee and deep dive into those areas. But the information is here, so we already have a good background as to what is taking place. So we thank you for that.
Of course, and I also have someone from that project, the PMO office, just in case you have questions for them.
Okay, so that would work out.
Yes.
Perfect.
Okay. In conclusion, the Department of Health continues to fill critical vacant positions by offering training and educational opportunities. We will continue our successful public relations campaign geared towards informing and educating the community of health risk and trends as seen across the nation. We'll continue to be the leading agency serving as unified command for the emergency response during this COVID-19 pandemic and strive towards improving the quality of services to our community. Once again, I would like to thank Governor Bryan, Lieutenant Governor Roach, VIDO8 staff, and our collaborators, locally and federally. Our federal collaborators include ASTO, CDC, Department of Health and Human Services, and FEMA through VITEMA and ODR for their strong support of the COVID-19 mission. In conclusion, Senator Kurt A. Viale, the Department of Health is committed to reducing health risk, increasing access to quality health care, and enforcing health standards. As stated, COVID-19 has once again increased awareness in the importance of preventative care. In other words, public health. As always, the department commits to building public health services that the community can trust and rely upon. We commit to collaborative effort with the members of the 33rd Legislature, Senators. This includes our testimony. Thank you for your continued support. This ends our testimony. However, my team and I are here and gives you the opportunity to ask us questions, and we're ready to respond. Thank you so much.
And thank you so much for your comprehensive testimony. We're next going to go to the Virgin Islands Board of Nurse Licensure. You may proceed. Ms. Penn. You may proceed.
Good afternoon.
Good afternoon.
Good afternoon.
You may proceed, Ms. Penn.
Okay, I'm coming. Good afternoon, Senator Kurt Viale, Chairman, Committee of Finance, members of the 34th Legislature, Office of the Commissioner of Health, members of the Virgin Islands Board of Nurse Licensure, the listening and viewing audiences. Thank you for the opportunity to present the Virgin Islands Board of Nurse Licensure budget for 2022. I am Tanisha Penn, Chairperson for the Virgin Islands Board of Nurse Licensure. I'm joined by Mrs. Carmen Van Spool Romney, Executive Director, and Mrs. Arnel Commission, Treasurer of the Virgin Islands Board of Nurse Licensure, and other members of the board virtually. The following summary of activities will highlight the board's work for the past year and clarify our budget request for the fiscal year of 2022. The Virgin Islands Board was created by the Virgin Islands Legislature to promote public protection and safety through the regulations of nursing practice in the territory. To date, the board is fulfilling the purpose for which it was created. The board's duty is to ensure that we approve duly qualified, competent nurses to practice in the VI. The board continues to have active membership in the National Council of State Boards of Nursing. Board members represent the territory at the National State Board of Nursing in annual meetings and conferences. The role of VIBNL is to ensure that only qualified applicants are approved to practice nursing in the territory. It is our goal to safeguard and ensure that members of our community receive quality nursing care during their time of illness. Additionally, the role of VIBNL is to protect and defend the people of the Virgin Islands from illegal and dangerous nursing practice, which is accomplished by a rigorous and comprehensive review process of all persons applying for licensure. Upon receipt of completed nursing application, the VIBNL staff and board members perform a thorough review and vetting process. Once the applicant is approved by the board, this person then becomes eligible to practice nursing in the VI, to be employed in the various healthcare settings, and to contribute to the health and economy of the territory. VIBNL is governed by the Nurse Practice Act, in which standards of nursing care are clearly defined. The Nurse Practice Act specifies that the board consists of 9 members appointed to serve for 2 to 3 years by the governor. VIBNL presently consists of 6 members. 5 members would make a quorum. The board clarifies scopes of practice for all levels of nursing personnel. It means that each level of nursing, advanced practice, registered nurses, Licensed practical nurses and certified nursing assistants are required to function within specific professional practice perimeters. All registered nurses and licensed practical nurses who hold active licenses issued within the territory can be verified by quick confirm process via our nurses database. This quick confirm report can be accessed and completed by the public, employers and staff, and agencies for free. The Nurses Quick Confirm program assists in keeping the public, nursing boards, and other credentialing agencies informed of nurses' ability to perform ongoing, safe, quality care to patients across the United States and the territories. We are working with nursing education programs in the territory to support the education initiatives that will provide our community with qualified graduates. We congratulate each of our nursing graduates of the class of 2021 from all nursing education programs. It was requested by the 2021 nursing seniors at the University of the Virgin Islands, and it was granted approval by the board for sophomore students to sit the Pearson VUE Nursing Assistant examination. There are 3 types of licenses: advanced practice nurses, registered nurses, licensed practical nurses. The VIBNL is also responsible for the certification of certified nursing assistants. Advanced practical nurses and RNs renew their licenses on the odd years, and the LPNs and CNAs renew their licenses and certifications on the even years. To date, VIBNL consists of a total of 1,338 licensed applicants via our nurses database. We break that down, 1,250 registered nurses. We have 89 practical nurses. However, this excludes our advanced practical nurses. We have a total of 139 advanced practical nurses. The certified nursing assistants, we have a total of 144. These numbers, however, do not include incomplete endorsement applications or incomplete renewals. Okay, ways in which the board carries out its rules as described above, I will share a few. The first one, VIBNL assists with and clarifies the scope of practice issues that arise for licensees in a variety of practice settings. These settings include hospitals, schools, clinics, private and group practices, industry, prisons, universities, nursing homes, group and private homes, and other health-related entities. VIBNL establishes criteria for initial licensure and recertification. We also certify and approve continuing education providers and programs to enable licensees to maintain their certifications. VIBNL reviews all licensees from applications of other districts and states who present for licensure in the VI. VIBNL as well protects the community by investigating all written complaints against a licensee or certificate holder and carries out the authorized action on his or her credential for any proven violations of the Nurse Practice Act or the Certified Nursing Assistant Executive Order. Those are just to name a few. We're going to move forward with our major accomplishments for 2021. It's great to say that VIBNL has maintained a nurses database where we can easily generate demographic and statistical reports on all nurses practicing in the territory. So for now up, we are 100% up to date in uploading those information, and we continue to do that. Another accomplishment that we have, we became part of the National Practitioner Data Bank for Advanced Practice Registered Nurses. And this is a confidential information clearinghouse with the primary goal of improving healthcare quality and protecting the public and reducing healthcare fraud and abuse in the United States. We did another wonderful thing, onboarding 4 new members to the board in December, with 3 new members pending full body approval, at which our membership will be at 8. Full board consists of 9 members. We currently have 2 licensed practical nurses, one St. Thomas St. John and one on St. Croix. We have 2 varied nurse specialists, both are on St. Thomas St. John District. 1 lay person on the St. Thomas St. John District. 1 nurse anesthetist on the Croix District. We'll be 8 members aboard after final confirmation by the Senate. And the only position that will make us whole, a complete board of 9, would be the position 1 lay person from St. Croix. We were able to testify before the legislative body with regards to nurse compact licensure. We requested more time for deliberation, was granted that opportunity. Thank you, Senator Verley, for that. During this time, we were able to allow the nursing community an opportunity to complete a survey to convey their support. The survey revealed over 90% approval for the Virgin Islands to become part of Compact. This was a joint effort with the National Council of State Board of Nursing and Virgin Islands Nursing Association. And we are thankful for the extended time and pleased to say that the board has listened to the nursing community and will support the efforts of Bill number 34-0040. We were also able to complete our move to our new site on St. Thomas at the VI Medical Foundation building. Our on-site website, our online website is almost complete. Some additional details are needed to be finalized. Assistance is given by the Bureau of Information Technology. Our goal is to have the website completed by September 2021 to provide a portal for accepting online applications. We also approved 2 nursing assistant programs in the St. Thomas St. John District with a pending approval for 1 new nursing assistant program on the island of St. Croix. These programs represent the first step in clients becoming certified nursing assistants. On July 9, 2021, we received our executive contract for CERTIMI. The Virgin Islands Board of Nursing is excited to announce that all nurses will be completing their applications online once the onboarding process and training is completed. The online process should be up and running by September of 2021 this year. Okay, moving forward to challenges. The board governs the licensure of nurses in our territory via the passage of 1981 Nurse Practice Act, number 4666, Bill 14-0094, Section 415, Title 3, Virgin Islands Code, Subsection 4, Powers and Duties, Bylaws, Rules, and Regulations, Certifying Officers. According to the bylaws for VIBNL, the chair is a certifying officer. However, after the expiration of the term of our chair in 2019, the previous 2 chairs or myself were not provided opportunity to sign off on financial documents. We have had meetings with the Commissioner of Health and the executive team and made them aware of our findings. However, we were told that the signatory had to be a part of the government of the Virgin Islands. The executive director, who is the official operating officer of the board, is part of GVI system. However, we were denied the opportunity to be part of the accounting process of our documents in the MUNIS system. Neither the executive director, the treasurer, nor I, the board chair, is any part in communication as it relates to the VIBNL and its finances. So moving forward to our new site, VI Foundation building, we're very gracious that the landlord has allowed us the opportunity to occupy the property since December 2020. However, as of date, we are still owing many months of rental, including December 2020. The lease for the property has been processed since April 2020. We are not in receipt of an executed lease for the same property. Without an executed lease, our electric bills cannot be processed. The Virgin Islands Board of Nurse Licensure was not given preview of some communication of documents pertaining to this lease. Hiring processes. For almost 1 year, the board has been trying to fill vacant positions. We lost the function of our compliance officer last September 2020 without due process by the board. This position is currently being utilized by the Department of Health, and because of this, the board is unable to fill this critical position at this time. The compliance officer is an essential employee for the board to execute its responsibilities. The completion for the hiring process of our administration specialist was filled in St. Thomas 1 month ago. We are currently waiting the hiring process for the same position of the administrative specialist on St. Croix. The board is encountering significant delays in the hiring process. Conscience Gada. Efforts to repair our old building site remains in progress. So our proposed goals for 2022. Goal 1, to complete the hiring process for the staff of St. Thomas, St. John, St. Croix. Goal number 2, rules and regulations. Revise, update, and prepare rules and regulations for public hearing, approval, and signature. Update and complete the Nurse Practice Act and rules and regulations. Goal 3, web building project. Continue the final stages of web building with Bureau of Information and Technology. Process should be completed by September 21. Our office space. Follow through on contract for both St. Thomas and St. Croix. Renewal online registration, begin the onboarding process with Certami, completion to be done by September 2021. Compact state licensure, support 34th legislature in the passage of Bill 34-0040. Meet with stakeholders to assist with the implementation process. Continue completing applications for all applicants requiring examinations. Licensure and regulation visibility, increase community visibility of VIBNL to promote effective communication and education of the board's role, policies, procedures, and to obtain feedback as we carry out our mission to protect the safety of the public. Continue education for nursing community, increase continuing education opportunities for our nursing community. As fiscal year activities are performed by the staff with assistance from the Department of Health, Payroll, and Financial Services, property and procurement for central government processes and contracts for professional services, requisitions and purpose purchase orders, the Department of Finance for federal processes and revenues and payables via Munis system. We, the board of VIBNL, request $536,885.10 from the general fund. This projected amount reflects salaries and bench benefits for 6 full-time employees, property rentals, and operating supplies. The breakdown for this is as follows. Personnel services, $274,242. Fringe benefits, $134,049.10. Supplies, $38,594. And other supplies and services and charges, $90,000 for a total of $85.10. We thank all those agencies who have assisted the VIBNL and with whom we have interacted over the years for their assistance in providing us with staffing and resources for training. We look forward to their continued support in achieving our stated goals as we carry out our mission of public protection and safety. We await any questions or concerns that you may have.
Thank you for your testimony, colleagues. We're going to go straight into a round of questioning. We're going to begin with Senator Blyden, 6 minutes.
Thank you.
Before you, Senator Blyden, thank you, Senator Gittens, for coming. Senator Blyden.
Thank you, Mr. Chair. Good afternoon again to my colleagues. Good afternoon, Commissioner Encarnacion, CFO Hewitt, and Human Resources John Baptiste, and Assistant Director, Assistant Commissioner Sims, and all other management staff and support staff there. And thank you so much for that very comprehensive testimony. Also, Ms. Penn, good afternoon to you and your team, and thank you for your testimony. I see, let me go to you, Ms. Penn, quickly before I go to Department of Health. I see there have been a lot of improvement with the board, and I really want to thank you for that. It's much appreciated. Commissioner Encarnacion, you have a large shoes to fill, and I must say you're doing a pretty good job, you and your team. I have some questions in terms of the budget, though, since the budget hearing. Let's start off on page 5 in the postal report, 5 of 34. Let me ask quickly, on our professional services, most departments I've seen coming here, I have seen an increase when it comes to personal services and French benefits, but there's actually a decrease, even though it's not a large amount of 27,510. There's a decrease in the personal services, and there's an increase on the French benefits of some $91,000. Can you explain the reason for that? Are there more federal funding in terms of folks moving over? What's going on in that space? Succinctly for me, please.
The Commissioner mic, please. Commissioner Encarnacion.
Mike, the mic for the Commissioner, please.
It should be working now, yes.
Yeah. Good afternoon. And I'll have CFO Hewitt explain the decrease.
Hi, good afternoon, everyone. So the increase and decrease, the increase is due to, retirement changing and also insurance, because sometimes, new employees come on board and they have family insurance versus, single.
Okay.
Or sometimes you have new mothers who have changed to family also.
So what about the personal service? How many vacancies do you have, as a matter of fact?
I'll defer that question to DC Joan Baptiste.
How many vacancies do we have at this point?
Good afternoon, Senator. Joan Baptiste. I will answer your question right now. So for this year, we have a total of, on our general fund, we have a total of listed of 54 vacancies, of which 27 vacancies under the general fund. We are actually halfway there in filling those vacancies at this point.
And how many have left due to retirement or separated?
Sure, 11 in total, sir.
Okay, now let me go back to Ms. Hewitt. Also, on the same page, when it comes to other services and charge, there's a $4.5 million variance from 13 to 8.5. Why?
The reason for the variance is that our East End Medical Center, $1,900,000, and also our Frederiksted Health Center, $2,150,000 was moved out of our general fund miscellaneous budget for a total of $4,050,000.
Okay,
and the balance is due to shifting of funds to our health revolving fund.
Okay, that makes sense. Okay, thank you for that. Let's go to page 10 of 34, your federal grants. I note that the Commissioner mentioned that there were no funds sent back in terms of federal funds, but there are many, this chart is extensive, $61.2 million balances, and many of those different grants have expired. So for those that have expired, were they extended, all of them?
All of the grants have been extended on the authority, so yes.
2 minutes.
Okay, so as far as the grants, do we start utilizing all those funds?
We have access to them until the funds are, until the grant actually period expired, so we don't have to worry about that anymore.
Okay.
At least not right now.
I'm happy to hear that. That's very important. Okay, very well. Let's go to page 14 outstanding obligations. I see you have 6 outstanding obligations by 6 different vendors, and they're all payment are in process for all of those vendors. Or have any of them been paid thus far, or are they still in process?
Senator, all of them have been paid so far, but currently we do have outstanding obligation for the month of May and June for our off-island facility, and that's totaling $1,273,244, and they are going through the process. Some are at property and procurement, about $713,265. Some at DOF for processing for payment, a total of $154,950. Some are in-house for approval, $174,468, and also some are we just received from pending vendor information, the invoice of $139,561.
Okay, let's go to your contract listed on page 16. Start on page 16. You have, again, an extensive list of different contracts. Many of them at no cost, but some of them do have a cost. Some are also federal, and several of those also have expired, but there's no information in terms of where we're at with those contracts. So if at a later date you can send a listing of exactly where we're at, that would be much appreciated, because there's no information in terms of what happens for those that have, well, first of all, are they up to date? Are the contracts up to date?
We have another document that shows all our updated contracts. Currently, we have 85 pending contracts, 56 71 actually executed. DPP, they're right now working with our Office of Procurement, and right now we have 8 on our desk in preparation to send to DPP.
Okay,
so we're working on them.
Okay, thank you. And finally, Mr. Chair, your vehicle listing, you have a large fleet, but many of them are in poor or fair condition. Do you have a plan in terms of addressing those on your fleet?
Oh, yes, actually. Basically, what we do on an ongoing basis, and I actually have our Deputy Commissioner as well as AD Lee Evelyn would be able to speak to that, but we actually do the routine maintenance. That's basically what we do, and we try to keep up with our payments so that whenever we need a fleet fix, it's fixed. We're members of the fleet fixed.
Okay, very well. Thank you so much, Mr. Chair, for the time, and thank you for your responses. I wish I had more time for Ms. Hewitt, but I mean, Ms. Penn, but nonetheless, I guess I want to drill down. Thank you so much, Mr. Chair.
Thank you, Senator Blyden. Ms. Hewitt, didn't we move Eastern and Fredericksburg Health Center under Human Services last year?
No, we didn't.
Okay. Senator Joseph, you recognize.
Thank you, Mr. Chairman. Thank you.
Senator Joseph, Mike.
Thank you. Thank you.
1 minute.
Thank you.
Yes, that's it.
Thank you so much, Mr. Chairman, for the time. A pleasant good afternoon to my colleagues as well as the testifiers here today. This was a very comprehensive testimony that we are receiving relative to the Department of Health as well as the Board of Nurse Licensure. My questions are going to also focus on your grants. Primarily, I wanted to get from you, you indicated that all the grants have been extended. Kindly indicate what is the extension date? Is it perpetual, or you don't have a end date for the grants?
Currently, no end date. It's when the money is expended.
Okay, so you got a waiver from, I guess, your cognizant agency or your funder to do that?
Yes.
Okay. Fine. Now, you also represented in your testimony relative to your indirect cost rate that you don't have one. Is that correct?
Yeah, it's the GVI indirect cost rate that we actually are applicable to. So currently CFO Hewitt, or actually I have my Director of Federal Grants on the line. She would be able to speak to that. Director Johannes, can you assist with that, please?
Good afternoon. Hi.
Good afternoon.
My name is Eleanor Johannes. I'm the Director of the Office of Federal Grants Management. And our indirect cost rate that we're using presently is 16.60%. That rate came out in 2018. We get a 1-year rate every year. It comes, over the entire GVI, Government of the Virgin Islands. Our rate is not calculated here, but it also has to be vetted by the Office of Interior.
Right.
So
I understand that, and it has to be. And this is from when? 2018, you said? So you don't have up to date, or is it this indirect cost rate is just extended?
This indirect cost rate is expired on 2019, but with permission from the various grantor agency, they
allowed you to use it.
They allow us to use it. Yes.
Okay, good.
It's
because
not in other cases.
Okay, thank you kindly for that remark. I want to ask you, Commissioner, because I was looking through, where is it? Some of the budget that you have, which your personnel listing in our post audit. And kindly turn with me to page 27 of 34, because there is I understand the hierarchy of the nursing profession. And I looked and I saw that a LPN, a licensed practical nurse, is earning more than a nurse practitioner, which is at the high end as far as professional nursing. And I wanted to ask you how that occurs. Specifically, 27 of 34, you'll see the licensed practical nurse, the annual salary is $86,775. And then you have at the very bottom of the chart here, the nurse practitioner, which is at the high level in the nursing profession. And this nurse practitioner, I understand, could write prescription. You could tell me if I'm incorrect. And they're making $84,550. What causes that? And if you could be really succinct, because I really want to jump on into the Virgin Islands Board of Nurse Licensure.
2 minutes.
I would actually have to look into that. A licensed practitioner nurse at $86,775. That may be an error. So I'd have to look into that and then get back to you on that.
Okay, granted. Thank you kindly. Now let's move on to the Virgin Islands Board of Nurse Licensure. Nurse Penn and also Ms. Carmen Vanterpool Romney. I noted in your testimony you've been having some challenges. You are actually occupying an area, I guess is because your initial facility has been damaged for some time, and now you don't have a lease, but you're trying to be operating in good faith, and so you could have an accommodation that is environmentally conducive for you to do your work. What is causing you not to have your lease in place? Because that's troubling to me. You don't have a lease for the foundation building complex that you're occupying.
Good afternoon. Yes, Senator. We don't have a lease for the property that we're residing in at this time.
Okay, what is your challenge? What is your challenge? Because that is not good. It is very poor management, and I'm not blaming anybody because you need a place. So where is the hold up? What is the hold up and the bottleneck?
Okay, so I'll defer that question to Ms. Romney.
Good afternoon, Carmen Vanterpool Romney, Executive Director at Virgin Islands Board of Nurse Licensure. We Our contracts and our lease goes through the procurement office and through the Department of Health. Last I know of it, it was at Property and Procurement. However, there are certain information and certain communication that the board is left out of in regards to our lease or contracts, etc. So to really understand where it's at, I will have to ask the procurement office, Ms. Holly, if she's available to answer you clearly on that, because we have limited information as to what's going on.
Thank you. Mr. Chairman?
You may conclude. Go ahead.
Mr. Chairman, it is really placing the government in jeopardy if we are not able to have executed leases and we have an issue that they are unable to occupy their former location because of hurricane damages. Now they are forced to operate in a place where they don't have a lease. So I have some concerns about that. And then also, Mr. Chairman, if I may ask one.
You're asking a question to who?
To the procurement officer to find out where we are with the lease. So Commissioner, if you would allow your procurement officer, and I do have, if permitted, to ask one more question.
Let her answer. Go ahead.
Ms. Harley's on the line. She would be
Ms.
able to
Harley?
respond to that. Doris Harley?
Good afternoon. Doris Donald Parley, Chief Procurement Officer, Department of Health. In regards to the lease for VA Board of Nurse licensure, they actually were occupying space in Roy Lester Snyder, and they moved to the foundation building prior to the execution of the lease. Right now, everything is at DPP. We're waiting for Board of Nurse licensure to provide adequate proof of funding.
That's not true.
I have the emails to prove that.
There is some kind of disconnect happening with the Department of Health and the Board of Nurse Licensure. Mr. Chairman, may I ask one final question?
Go ahead, just make it succinct. Go ahead.
I will endeavor to do so. My concern is regarding in the nurse licensure testimony where they indicated a compliance officer was moved.
So ask a question directly.
What happened? Why was the compliance officer moved from the Board of Nurse Licensure and into the Department of Health? And why haven't we freed up the funding for the department, the Virgin Islands Board Nurse Licensure, to have that position as a vacant position to be filled? Because that person is no longer there.
You have the question. Go, let them answer.
You asked several questions.
Okay.
The compliance officer.
The compliance officer. Okay. Why isn't it? Is it reflected on being the salary for that compliant officer? Is it being absorbed by your funding?
Right now, it is actually being absorbed by the VA Board of Nurse Licensure. We actually.
Why?
May I? Mm-hmm. Okay, good. We actually had a meeting with VA Board of Nurse Licensure indicating that we were having some challenges between VI, the Department of Personnel as well as DOH. We actually fixed that. So all documents were uploaded within the last week or so. So we should be able to resolve that within the next couple of weeks. And so, yeah, that has been, but the communication has actually been there. So they're aware. And then we also let them know that we will go back to OMB to ensure that whatever funds that we have expended using VI Board of Nurse Licensure funding, even though we were housing that staff, to give that monies back to VI Board of Nurse Licensure.
Very good, and to make them whole. Mm-hmm. Okay, Mr. Chairman, that concludes my questioning. Thank you.
Thank you, Senator Joseph. Senator Francis.
Thank you very much, Mr. Chairman, and good afternoon to everyone. Thank you to the Department of Health for the comprehensive testimony that we gave this afternoon. I wanted to start off on your good afternoon, Commissioner. In regards to page 15, where you spoke about the Anazoe site, as you would imagine, I wanted for you to expand a little bit in terms of the conversation regarding sending additional information down to the legislature to reappropriate the funding for E&E. Can you speak a little bit on what you intend to do there?
Of course, Senator. Thank you for that question. So actually, we submitted to the Department of Public Work for a request for a scope, and so that we can actually, we went through an RFP for an A&E company. The Department of Public Work indicated they did not have the specialty to provide a scope for behavioral health services to that extent. And so they are now writing us a documentation so we can present to you that two things. One, it's actually more than 50% destroyed, so we actually have to remove that entire area and rebuild. That's one. And two, for the reuse of that monies to an A&E, and we're now asking the Office of Disaster Recovery to use their A&E firm that works with them for that purpose. And it goes beyond that, Senator. We're actually trying to now secure other funding so that we can actually build once the A&E provides us with the build out or the recommended build out. So it's a long, but Office of PMO is also here, as well as Deputy Commissioner Renensil, who would be able to maybe give you a little bit more information, but that's it in a nutshell.
Commissioner, we need to remove all the barriers that are preventing us from getting this thing completed or getting it done and really move forward on this. So we need to take time, night and make day, and whatever we need to do to move, whether we need legislation, then we need to really complete that. I think that we continue to spin wheels and be able to address this particular issue as it pertains to behavioral health. We need to remove the barriers, whatever it's going to take to get this moving, Commissioner.
I understand your frustration.
We continue to cooperate, so that we can really make an impact in our mental health situation in the territory.
I understand your frustration, sir. Thank you.
Thank you. So in respect to the federal funds, some close to $61 million, I heard your response to my colleague in respect to the extension in time on those federal monies. Do you have a self-imposed timeline? I know that a lot of this federal money is for services and to be able to impact our community. Do you have a self-imposed timeline in which you intend to, or you seek to expend some of this money again, and hopefully the members of this community could be a beneficiary of that expenditure?
We are expending them as we speak. And one of the things we spoke about is EpiN laboratory, where now we actually just all of our tests and supplies, our PPEs are also expended through that. In terms of immunization, staffing to cover our CBCs, so we continue on a daily basis to expend those.
Okay.
I need to.
Commissioner, why does the vital statistics have restricted hours, only opening half a day and sometimes 3 times a week?
Oh, only this last week and this week, and that is actually because we too in the Department of Health sometimes are affected by COVID.
Okay. So that's not a normal situation.
No.
It's just as a result of an outbreak?
Yes, sir.
2 minutes.
I won't call it an outbreak, sir. I would recommend that we had an exposure, and because of that reason, we had to make sure we reduced in terms of the safety of the staff and the community.
Very well. Very well. I appreciate that. Parkwood Medical Services, $2.4 million per month. Who's monitoring to make sure that we get a return on our investment?
We actually monitor staffing schedules, staffing listing, as well as hospital, health, human services, and our EMS, exactly when they work, when they call out. It's not perfect, just like our staff, but we're really trying to get there.
Well, we'll continue to carefully monitor the situation.
Yes.
Because there's a tremendous amount of money that's been expended there. I was happy to hear your discussion in regards to your collaboration and work with Island Therapies. We had an opportunity to take our Community of Health Hospital and Human Services through Island Therapies, and was amazed and surprised by the amount of services that they provide. So I hope that will be a continued collaboration as we move forward, especially as we endeavor to address some of our behavioral health situation. In respect to the current modulars over at the Charles Howard Hospital, do we have sufficient space there? Do we have adequate spacing and everything at the modular?
We do have adequate spacing. We did have some issues in terms of mold in building 1, and because of that reason, we actually had to evacuate, and we moved out. Actually, my office is no longer in building 1, and so is most of my team. And we're actually in the process of moving the clinic from there up to the annex so that we can have a safer environment. But besides that, we do have adequate space.
Time.
Well, what's the morale of staff at this time? I know that they have a tremendous amount of responsibility and a heavy lift in the community. What is the morale of your staff?
Taking a
How are you working to address that?
taking a temperature, as we said in the report, the behavioral health has actually extended their services first to our staff at the Department of Health, and breathing exercises have been done. We've really been trying. I have to tell you, our CFO, Tatiana Hewlett, has made sure that we continuously provide incentives and provide gifts to the staff to let them know how much they are cared for, because in order for us to be able to care for the public, we first have to care for our staff. I can't say that our satisfaction at this point in time, because they work hard and they work long hours, but I think that they love what they do, and I think that brings a level of satisfaction that can be monitored.
Very well, I want to, at this time, thank them for all that they continue to do under these tough COVID times, and we certainly appreciate their work, but again, we got to make sure that they're well. And if I could just wrap up with this final question or comment.
You may conclude.
Chair, I will ask that the commissioner to personally get involved in this situation with the Board of Nurse Licensure in respect to their lease or contract, so that we see to it that there is some movement to resolve that particular issue. I'll appreciate it. Thank you very much, Mr. Chair, for the time. Thank you, Commissioner, for your responses.
Thank you.
Thank you.
If I may respond to that,
Yes.
about the, we're working also with OMB to make sure that we secure the funding, especially since they began working in the building prior to the contract, the lease was actually signed out. So we have to negotiate funding for that as well. And so that's kind of like one area of where the holdup is. But we'll work with OMB as well as Board of Nurse Licensure to secure that.
Okay, thank you so much. I think we're probably going to need to have an offline meeting to discuss exactly who has oversight in terms of budget, et cetera. But I'll speak to the chair and we'll see how we arrange that. The PAFL contract is a bit costly. It's costing us $26.4 million a year if we go at the 2. And I'm seeing that your budget is $28,663,000. Is there a possibility to renegotiate? I mean, that's really, really high compared to you having 400 plus employees and so much other areas that you must cover. That's literally almost the same as your budget.
Well, I would wholeheartedly agree with you with that. But what I would also remind you too is we're not just covering Department of Health staff and EMS. We're also covering hospitals. The amount is still, and there's always a way to renegotiate. So I'm always for renegotiating. Of course, they're paid for by federal funds.
Right, but we still want to.
But still, it's being paid for.
And just put in a word out there to PAFA, the owners, that I think they need to revisit the present negotiation or the present contract. I think that they're getting quite a bit, and we should be provided a better rate. They've been here for more than a year. We're thankful for the services that they have provided, but I think it's time for us to renegotiate.
One of the things I'd like the public to know, Senator, if I may, they bring down staff, but they have actually hired a number of staff locally as well, because we made that. Okay.
Okay, that's good. Senator DeGraaf. Senator DeGraaf, mic, please.
Good afternoon. Thank you, Mr. Chair. Good afternoon, colleagues. Good afternoon, testifiers. And for how you're handling the COVID, kudos still, and pass it on to your staff. Excellent job to me.
Thank you.
For the people who make